Welcome to session 6. I mean, we are reaching very close to session 10. That's something really bothers me. And the topic of discussion today is handling patients. Though I have titled it as uncooperative patients, but incidentally, I do not like to call it uncooperative patients. Maybe when the patient does not understand our point of view, or when they are not able to, do things the way we want, we find it difficult to handle those situations. So, for example, you need blood for your patient, and you want the patient and the family to replace blood. You will see if there are situations they don't want to do it. Or if it's a small hospital and you want the patient to be moved to a tertiary care hospital, and you request the family to take the patient to, a higher hospital. I'm sure people working in smaller places must have faced a lot of resistance from the family to take the patient to the tertiary care hospital, especially in rural India. That's one of the challenge I'm sure we all face. Can you share some situations where you feel that patient is not really understanding your uh, perspective, or you're finding it difficult to help them see what you want? Yes, Dr. Priyanka, go ahead.
I think we face it almost every other day in the labor room.
Mhm.
When someone has got admitted for induction of labor, or if they have come in labor, but there is reasons to do a cesarean section.
Oh, yes.
Always think that you are forcing them, either because. So I'm very happy if the hospital, like the previous hospital, had the same rate for vaginal. I don't even say normal delivery. That's why I tell them vaginal birth, cesarean birth. So they don't think that it's because of 90% they understand, you have been with them, but sometimes there are some patients who really want to not try to. It takes a lot of time to convince them why we are doing it. Like this will not end up in a successful vaginal birth, but they want to wait till the end, and then they blame you that you could have decided earlier. Why did you want to wait? Once the baby is delivered, and then if the baby is in NICU for more than a day, then they will say, oh, baby got infection. So this is something we see every day.
Thank you for sharing that experience, Dr. Priyanka. Yes, dear Dr. Suyog, I think you also have something to share of a similar kind. Yeah, go ahead, please. You're not audible. Dr. Suyog, I think, yeah, you're not audible. There's some network issue, I think, that you're in. Switch off your video. Dr. Suyog, please switch off your video and then speak.
Hello? Am I audible?
I think you will be audible now. Please speak. Yeah. Yeah, go ahead.
Is this okay?
It's better.
Yeah. Since my experience has been mainly into family planning. So my experience has been mainly into family planning, and I have seen a lot of families, and especially the rural women. They are not very enthusiastic, or they do not want to take any contraceptives. And even if they are having like 6 or 7 babies, and yet and the spacings that we want between 2 pregnancies, they do not want to keep that unless and until they do not have the male child. There is some family pressure and everything, all those things. So it's very difficult in those rural settings to tell them, so what are the benefits and what
I'm sure. I think this is very common, especially in rural India, where they don't understand the importance of spacing between 2 pregnancies. I completely understand, and I'm sure you must be having, tough time convincing them for something like this. I completely empathize. I understand with you. So, anybody else who would like to? Yes, Dr. Pradeep and Dr. Mehul. Yes.
This happens every now and then. The hypertension and diabetes being asymptomatic diseases, they are silent killers. Many times we detect very high degree of hypertension to the tune of 260, 160 or something like that, and the patient is totally asymptomatic. It becomes a little difficult to convince him that he is suffering from hypertension and he needs treatment. The first thing comes from them is that once we start the treatment, it will be a lifelong treatment. Uski aadat pad jayegi, something like that. So it's our job to convince them that it is not aadat pad jayegi, it is the need of the the body, and probably the benefit will far outweigh the any side effects of any of the medicines. And if you don't tolerate one medicine, we have got plenty of them. We can always change and give you which suits you best. But most of the times we are able to convince them.
But I'm sure the kind of experience you have, you may not have that much of difficulty, and especially if the patient sees you as a seasoned clinician, they would normally get convinced with the way you explain. I think the bigger challenge is with the young doctors who are still learning the way of talking to the patient, and also being patient in helping the patient understand why they need to work on themselves or bring about lifestyle changes or start with medication, especially as you said, in cases where the patient is asymptomatic, they don't feel the need to take it and they fear they'll have to take all their life. So with you probably it may be much much easy, but I'm sure with the younger doctors it must be really very difficult. Yeah, thank you for sharing your experience. Yes, Dr. Mehul, go ahead please.
So in the ICU, what we've come across is some of these patients who come out to be very hostile, especially when on small things they are picking on. And when we sit into the details of it, what we have found is a couple of cases where, let's say it's a surgical patient after the operation does bad. And you tend to try and sit and counsel them because they are daily complaining. On a daily basis, there is a complaint. Sister did not tell me this. I did not get an update. Doctor did not talk to me. This is happening. This did not happen. The food did not. So there are inevitable complaints, and these are the ones who are a little difficult for us. And they start turning hostile when they say that this doctor said this and you said this, and this doctor said this and you said that. So they start playing that game. And they inevitably become like, the staff always is like, sir, can you please talk to them? Can you please talk to them? There's persistent complaints about these patients. This is for an ICU scenario. And what we commonly see is in these people, we generally sit down, try and talk to them. And you'll be surprised that inevitably there is one family member who is the one who is complaining. And that is the guy who has gone against the whole family and said, no, admit the patient, or no, go and get the surgery done. And now things have turned west. So they are now feeling the guilt for it. So sometimes we've always realized that in the family, there will be one person who is a little too projectile and is volatile. And we try to find out this. Commonly, we've seen, madam, especially after a surgery, when things are going bad. And then there is one person in the family who has said, no, we should go in for the surgery. And now when things have gone bad, he feels he is the culprit. And those are the times that's something what we have, there's something what we have learned and what we found that has learned that if you catch that person and you understand what that person has, has done is not wrong, and you try and convey it to the family members, we find a lot of the problems slowly simmer down. So we need to, in all these situations, especially in the ICU when things are going bad, it's a life and death situation, we tend to find these people throwing rockets all around. That is the best time when we need to sit and try and understand what is the problem. Besides that, there are always problems, at least for ICU, it is always that, the primary doctor, that is, let it be the surgeon or let it be the medical person, would come and have his own story. And there are multiple references. And then we would be the ones who are 24/7. So morning kuch bol ke jate hai, sham ko kuch ho jata hai, and then they turn completely west and they are like, no, this was not told to us. This is what is happening. So I think the crux of this point was that you need to sit down and connect with one family member, try and find out what is the root cause. Inevitably, what we've noticed is the root cause is a guilt.
Could be, definitely, yeah. Especially the cases that you are talking about where things have gone wrong and it's one person who has taken the responsibility.
Yes.
There's all possibility that person is burdened with the burden of, taking the decision and that decision going wrong. At least not in the interest of the patient. So definitely, I mean, there can be all sorts of reaction that the person
Just
can.
And then they go on to small things. You didn't allow me to come in at this time. The feeding is not happening at
And
the time. The
it could
food
be
which is
other
ordered is
family
not coming.
members. And Dr. Mayo, it could be the other family members because they're unhappy with the decision. So they want to prove it that
Yes,
decision that you have taken is not right. And
is not
I
right.
mean, there are so many problems that you did not care to, check for all this. And now see, a patient is suffering, we are suffering, but you thought what I'm deciding is right. So it could be anyway. Human mind is very complex. Human behavior is not easy to, define in few words. Every time there will be a different
We've
situation.
had, madam, a case right now also, which is there. There are two sisters.
Hmm.
One is over here and one is overseas. The one who was over here wants to continue everything for an
Hmm.
87-year-old lady, and the one who is overseas does not want to do anything. The patient went on for 20 days because we had to do everything and we were not getting a refusal sign. The patient got better. So
Hmm.
that sister tells the other sister, see, you wanted to give up on my mother. The lady landed up going back to the ward, then having another event and come back.
Oh my
And
goodness.
now she is in a bad situation. So now these both are fighting amongst themselves, and we are getting stuck between their small complaints between each of them. So the thing what we did in this situation was we got the medical admin and we got a lawyer from
Hmm.
the hospital who had to sit across and talk to them. And we started video recording these conversations. And when
Hmm.
we started video recording the conversations, the naming, no, but this one said that and that one said that, started reducing because we had to put them on record and we
Hmm.
had to get them signing every of our meeting.
Yeah.
Otherwise, madam, it gets so tough sometimes here when we're dealing with people who are
Especially the
one
kind of
relative
clientele
overseas and
you
one
have.
relative in India.
Especially the
It's really
clientele you have is very, very, very
yes.
VIP. So I'm sure. Thank you for sharing that. I think Dr. Praveen wants to make a point.
just half a minute, not a longer one.
Please go ahead.
Just
Yeah.
a similar situation is you have to understand the psychology. I've been working with railway, so industrial organization.
Hmm.
So sometimes the person who is trying to complain is trying to show his importance to the menfolk
Hmm.
around him. Look, I'm doing it for you. So there will be 20, 30 people around him, and then he will talk to you. So that time
Yeah.
he is not concerned about the patient at all. He is
Yeah. It's
only
ego.
trying to show off.
Oh,
So
yes.
that time you just listen to him, and later on you can explain to the relatives are happy with you. But he wants to show that, "Okay, look, I
But
have
yeah,
come, so
see,
I have done something for you."
yeah, I,
Yes,
it's
something like
true.
that. So that happens quite often in with union leaders and all that. Yeah.
Excellent. I think you have all brought in a lot of good points, I think. And that builds the context of today's session. So handling such situations require a lot of deeper understanding of human psychology. Like Dr. Mehul said, like Dr. Praveen said, like Dr. Priyanka said, and Dr. Suyog said, that you have to go deep into understanding why they are doing that. If you develop that understanding, I'm sure you will actually be able to identify what you need to address. So I think one message that I get from your discussion very clearly is, don't deal at things at superficial level or at the behavioral level. Try to go little deeper inside. You will understand why this patient is behaving like this. So a lot of time, if you are able to address that why, most of the problems can be looked after very well. I think that was a very, very important learning for me also from the discussion that we had. At the same time, I would like to equip all of you with the right skill of communication. Because see, if you are a seasoned clinician or a seasoned nurse, you would know how to handle people who are not cooperating. You know how you have to go slow and then let them vent, and then you come to the point and then you handle them. But problem is, a lot of time when it is the younger staff who is handling it, young nurses, young administrators, young patient care coordinators, young doctors, they are the one who are not able to handle no. If they say something and the patient says no, they are not able to handle. Or if the patient is asking for something as simple as that, can you talk to my doctor who is who's abroad, who's my relative, and he wants to know about the patient condition. I've seen younger doctors saying, no, we can't do that. I mean, that's not possible. Why the hell should I talk to your doctor? Ask him to come and talk to me. I mean, what I'm trying to say, that's where the real problem, probably the ego comes in, or why should I do it kind of things come in. So in this session, basically, I want to focus on how do you handle such situations. We all have a default way of doing or handling conflict situations. Each one of us have a way of handling conflicts, especially difficult situation. But then, is that the only way? And is that the right way? I think that's the learning I'm expecting from today's session. So maybe what I will do, we will do a small role play. And this time I don't want seasoned doctors to take the lead of being the doctor on duty. I want somebody younger, because this is what there that is where our real learning will lie. So I want any one of you to volunteer to be the doctor on duty. And there's a case I will share the role play with all of you, where the patient's condition has deteriorated and the family is very unhappy and they want to go lama. So how do we handle that situation? I think that's something I would like to take as a role play situation. So who would volunteer to be the doctor on duty who is attending to the family of the patient, family where they want to take the patient lama? Anybody? I would prefer younger doctors. Younger, I mean, not like because those who have already done it, I'm sure, Dr. Mehul, you must have done 100 times. You're doing it every day, I know. I've seen your hospital. The kind of clientele you're handling, you can handle anybody. So, I mean, I don't doubt you're this thing, but I want somebody else to take this, not challenge, but there'll be a lot of, food for us to think and also points to learn from that. Mariam, will you take this? Or Archana, will you take anybody who is little younger? Because I want you to, try your hands at difficult situations.
Yeah, I'll be ready to take it.
Archana, you ready?
Yeah.
Okay. So Archana, you will be playing the role of a doctor on duty. Are you okay? Comfortable with that? Okay. So I want one or two of you to be the family members. Little aggressive because you are unhappy with the services and you are very unhappy about the patient's condition. So you will have to, be little rude. Okay, Dr. Mehul. Okay. So Archana, are you okay with Dr. Mehul being attendant? Fine. So it's all about learning from our experience, no? Okay. I want one more person with Dr. Mehul. Nivedita, will you be? Okay. So I will share this situation. Okay, Mariam was also okay with, but okay, two relatives are enough to trouble, Archana. Okay. So I'm going to first share the case situation so that you have little understanding of the back. All of us will switch off our camera and will 3 to 5 minutes be okay, Archana? Okay. Okay. And for those who are playing the role of the family, for you, the agenda is very clear that you want to take the patient away. Please be very clear about it. But let me show you the situation. So Archana, is the case visible to you and to other family members also, to the patient's family member? Archana, are you able to read it? Okay, let me know when you want me to scroll it up. Should I scroll up?
Yes, ma'am.
Okay. So can I stop sharing if you have all read the case? Okay. So we are all switching off our video, except 3 of you, and then we come back once you're done with it. And if I come back, that means we want to, end it. Yeah, go ahead, please. Yeah, assume that Archana, you are in the ICU, and Dr. Mehul, you will be a patient's son, and Nivedita, you be the daughter. So both of you have entered the ICU, and Archana is on duty. Yes, go ahead.
ये इधर आज डॉक्टर कौन है काम पे?
सर मैं हूँ। आप सुनीता का अटेंडेंस है क्या?
हाँ जी, आप कौन से डॉक्टर हैं मैडम?
मैं यहाँ पे ड्यूटी डॉक्टर हूँ आपका।
नहीं, मुझे आई वांट टू टॉक टू द सीनियर मोस्ट डॉक्टर, आई डोंट वांट टू टॉक टू जूनियर डॉक्टर्स। मेरे को मेरा पेशेंट लेके जाने का है बस।
आपका मदर का सारा ट्रीटमेंट मैं ही देख रही हूँ आज सुबह से, सो मुझसे ज्यादा कोई नहीं जानता।
मैडम,
आपको
मेरा
जो भी
पेशेंट
क्वेश्चन
चल के आया था। पेशेंट अभी आप बोल रहे हैं कि उसका पल्स नहीं है, यूरिन आउटपुट नहीं है, वेंटिलेटर पे है, लाइफ सेविंग मेडिकेशन पे है। कैसा मैनेजमेंट कर रहे हैं आप मैडम?
तो आप स्टेटस भी तो नहीं दे रहे हो मैम, स्टेटस भी तो नहीं दे रहे हो हमें।
पहले आपका मदर को थोड़ा स्टेबलाइज करें, उसके बाद आपको स्टेटस दे सकते हैं ना हम लोग।
तो
मतलब आप स्टेबलाइज, मतलब आप
Definitely.
इतने टाइम क्या कर रहे थे मैडम? स्टेबलाइज अभी कर रहे हो, मतलब व्हाट आर वी डूइंग?
उनका मल्टीपल ऑर्गन फेल्यूर है, बीपी डाउन हो रहा है बार बार, उनका मेडिसिन देना पड़ेगा।
तो
तो
आप
आपने
इधर उधर
स्टेपी
घूम
किया
रहे हो।
जब पेशेंट, देखो मैडम, पेशेंट आया था, उसको ब्लीडिंग हुआ था, हम लोग ने टाइम पे लेके आया, चल के लेके आया था पेशेंट, ब्लीडिंग हुआ, आपने बोला कि दूरबीन डाल के वो स्कोपी करने का है, वो भी स्कोपी किया, आपने बोला ब्लड देने का है, ब्लड भी दिया। एक एक करने के बाद आप बोल रहे हो पेशेंट अभी
कर रहे हैं
वेंटिलेटर पे गया,
हम लोग
यूरिन
भी
आउटपुट
सब
ड्रॉप
कर
हो
रहे
गया,
पेशेंट
लाइफ
को।
सेविंग मेडिकेशन चालू हो गया। मैडम
हाँ,
ऐसा नहीं होता है। आई थिंक यू ऑल आर किलिंग माई पेशेंट, आई वॉन्ट टू टेक माई पेशेंट अवे, बस।
आप मेरे
नहीं,
बात
और ऊपर
पूरा
से
सुन
नहीं
लीजिए।
आप लोग ऊपर से स्टाफ भी तो नहीं है का, एक बार स्टाफ इधर जा रहे उधर जा रहे, ये क्या हो रहा है?
आपका पेशेंट के लिए ब्लड लेके जाने के लिए जा रहे हैं, इंजेक्शन लेके आने के लिए कोई जा
क्लियरली
रहा
तो
है।
बता नहीं रहे कुछ भी ना, क्लियरली कुछ बता
पहले
नहीं
हम
रहे
लोग-
हो।
पहले हम
मेडिसिन
लोग-
कभी इधर दे रहे हो कभी उधर दे रहे हो, ये क्या हो रहा है?
पहले
मैडम
हम
आप
लोग
सीनियर
आपका
डॉक्टर को बुलाओ, आप सीनियर डॉक्टर को बुलाओ, लेट अस टॉक टू द सीनियर डॉक्टर। वो कौन
सीनियर
था जो जिस
डॉक्टर
दिन हम लोग?
सीनियर डॉक्टर को बुलाने की आवश्यकता कुछ भी नहीं है, क्योंकि
नहीं
मैं
नहीं
ही
मैडम,
हैंडल कर रही हूँ आपका बेबी को।
एक्सक्यूज मी मैडम, ये आपकी मम्मी होती तो आप ऐसे बोलते?
नहीं बोलते।
तो
डेफिनेटली
यू आर
आपके
डीलिंग
जैसा
विद द
नहीं
लाइफ
करते।
लाइफ ऑफ द
डेफिनेटली
पेशेंट।
आई कैन कम्प्लीटली अंडरस्टैंड योर सिचुएशन, बट मेरे बोलने का भी सुन लीजिए आप पूरा। आपका मदर का कंडीशन क्रिटिकल है, हम लोग कोशिश जरूर कर रहे हैं आपका मदर को लाइफ सेव
मैडम आप
करने के
कोशिश
लिए।
बात कर रहे हो, पेशेंट जब आया था चल के आया था, अभी आप बोल रहे हो
जरूर
कोशिश कर रहे हैं।
जरूर, लेकिन हमें और थोड़ा टाइम दीजिए। हम लोग
मैडम
आपको
मेरे पास
टाइम
टाइम नहीं है,
कितना?
आपको पता है बिल कितना लगाया है आपने? मेरे पास टाइम नहीं है मैडम, मैं बाजू के हॉस्पिटल में लेके जाएगा, वरना आप कल बोलेंगे कि
कहीं पे
पेशेंट
भी
नहीं
लेके
बचा।
जाओ, आप कहीं पे भी लेके जाओ, यही ट्रीटमेंट चलना है। अभी लेके जाने का सिचुएशन में भी नहीं है पेशेंट। आप अगर
तो
इधर से
पहले
लेके
देखो
जाना,
मैडम पहले
कैसी
बोलना
हालत हो
चाहिए
गई।
था ना, तो
हाँ?
पहले
तो
बोलना चाहिए था ना कि
पहले
आपकी
तो इन्फॉर्म
व्यवस्था
करना
नहीं
चाहिए
है।
था कि इतना खराब
आपको
सिचुएशन होने
इन्फॉर्म
वाला है।
करने का टाइम ही नहीं था हमारे पास, क्योंकि हम लोग बिजी थे उनका सिकनेस हैंडल करने के लिए। उनका सिकनेस हैंडल करें या आपको
अरे
बता के
मैडम
बैठे?
आप अकेले हैं क्या पूरे हॉस्पिटल में? दूसरे कोई है नहीं
नहीं,
जो हम
ये
लोग
जो
को
आईसीयू को
कम्युनिकेट करने
जो
के लिए के?
आईसीयू को हैंडल करने वाली मैं ही हूँ आज ड्यूटी डॉक्टर। तो जो भी बात करना है आप मुझसे ही बात करना है, और आपसे जो भी पेशेंट के बारे में बताना है मुझे ही बताना है। तो
लेकिन आप
एक
सब कुछ तो नहीं कर
मैडम
सकते
इतना
ना मैम।
टाइम से
सब
पेशेंट
कुछ
है
है मेरे
अपने
साथ, मेरा
पास, तो
स्टाफ है,
एटलीस्ट
नर्सेस
कुछ
है
तो
जो
इन्फॉर्म।
अटेंड कर रहे हैं। वही तो मैं बोल
इतना
रही हूँ, जो
टाइम से
पेशेंट को
पेशेंट का
हम
कंडीशन डिटेरियोरेट हो रहा है, कोई
एग्जैक्टली
अपडेट तो देना चाहिए था ना, बताना चाहिए था ना कि
मल्टीपल
इतना
ऑर्गन
खराब है
फेलियर
सिचुएशन।
इज नॉट ए गुड।
Archana,
No,
I'm
she held
very
on well.
sorry
She held
to
on
have put
well.
you at a tight spot.
No, but she held on well. She was. I
I did a
honestly
good
feel she was
job.
holding on.
Dr.
She was
Mehul.
holding on.
Archana, but I'm very glad that I asked you to do that role.
I really
Because,
did a good job.
no, why I'm saying this, we really got to see how our doctors, handle this situation. And how it ultimately ends up into either violence or extreme aggressive reaction.
I would like to say one thing here. I see this ICU counseling day in, day out in my NICU.
And this is how they do?
No, not much, because there are very small babies there, and most of them doesn't know what happened with small babies. And half of the time I am with the mother, and other parents are with the doctor's consultant. So I will I am the one who is giving emotional support to the mother most of the time. So that is the reason I could handle it much better because of my experience in NICU.
Wonderful. So, okay, I think she feels she has done well. Anything you would have done differently if I give you another chance, Archana? Anything you think you would like to do
Yeah,
different?
if I could get a help of a senior consultant, that would have been much better.
But you never wanted it. You were outright.
No, I was because I mean thinking about myself. It's on a holiday. There is no other consultant available. So I am the only one person who is available and have to answer that because it was my responsibility.
Okay, Archana, now a lot of things you said were right. But what about the tone of voice? Do you think that calmed them or that triggered reaction from them? Just
Uh,
reflect on it.
yes. See, it depends. I think my tone had started slowly, but I had to make up the tone because they were not ready to listen to me. They were blasting with questions. So that is the reason once I started raising my voice, most of the time, yes, there can be situations where some of the attenders might calm down. And yes, I would agree that there would be some of them
So
who it could
are
have
you trying
triggered
to,
more.
Archana, am I understanding right? When you say if they raise your voice, I have to raise mine so that I can.
No. It is not like that. I
I
was
think,
just trying to make my point. That's it.
but we will come about. I think that was a wonderful, I mean, a lot of discussion can happen about it. Yes, Dr. Priyanka, I think you wish to say something.
Yeah, so this is a scenario. Angry patient attenders want to take Lama.
Mhm.
You have a discussion, not increasing your baritone because it will. In fact, even we have situations where mother is very critical in the ICU patient. There is a big crowd of attenders outside. But if we are also ready, they will be. We even need to have bouncers with us sometimes because they even come, with threatening us.
A very
So
aggressive.
then sign the consent and take the patient because if the patient they are not happy with the treatment, they want to take against medical advice. That is their right. We don't have to go out of the way fighting with them.
Actually, honestly, in the whole discussion, I think Lama was never discussed.
Yeah.
It
If
was
I was
more like, uh,
and
question
forth,
and like argumenting and giving response. And I think that's what normally ultimately happens when we are not able to address their concern in the right manner, in the effective manner.
no,
Okay.
if I was in the place, I will just keep quiet.
Mhm.
Let them
Hold on,
finish.
hold on, hold on.
Lost.
I want others to share their thoughts. Uh,
Ma'am,
yeah,
the
yes,
thing is
yes,
that
Nivedita.
in her place, I would have said first make them sit somewhere else to
Mhm,
cool down, to think on that. कि
mhm,
हमने जो कर रहे हैं वो
mhm,
क्या कर रहे हैं. Let me explain you first instead of shouting on me. First,
mhm.
explain you. ये
नहीं,
देखिए हमने
अगर
जो
मैं ये
किया
मान
है.
लूं, निवेदिता, मैं अगर ये मान लूं कि पेशेंट ऑलरेडी मेरे पास 3-4 दिन से है. Okay, what I want to quickly do in this is I want Dr. Mehul and Nivedita to be the patient attendant and I would like to be the doctor on duty. Though I have videos to show you, but I want to quickly do the role play so that we get the ideas how we have to handle that situation. So can I request everyone to switch off your videos, and I request Dr. Mehul and Nivedita to be as rude, as aggressive as you were with Archana. Don't spare me, because if you do that, then we will not be doing justice to Archana. So I'm assuming that I am in the ICU and both of you have come in, and I say, Mehul, I think you are, Mehul, come in. You are Sunita's son, and Nivedita, you are,
Yes.
yeah.
Are you the doctor taking care of Sunita?
Yes, I think Mehul, we met in the last day.
No,
Also.
I want to talk to the senior doctor. I want to know who is the senior doctor because every day I'm meeting new doctors, madam. Every day I'm meeting new doctors, and every day there is new problems coming up. And now you have come up to a situation where you're saying there's a life and death situation. हमारा पेशेंट तो चल के आया था मैडम, थोड़ा ब्लीडिंग था, आपने स्कोपी करके सब ठीक कर दिया. अभी आप बोल रहे हो यूरिन कम है, वेंटिलेटर पे गया है, लाइफ सपोर्ट्स है. I think I'll rather take the patient to the next hospital. Otherwise, my patient will not survive over here. What do you say, Nivedita? What do you think?
Exactly.
How are
हमें
you?
कोई
What
स्टेटस
is
नहीं
your?
दे रहे हो आप लोग. हाँ बिल्कुल बिल्कुल बिल्कुल.
So
आप लोग को
you
स्टेटस
want
ही नहीं दे रहे हो हमें.
you want to
डे टू डे स्टेटस देना चाहिए मैम. आप लोग दे नहीं रहे हो. मेरे पेशेंट को क्या कर रहे हो, क्या मेडिसिन दे रहे हो, कुछ भी एक्सप्लेन नहीं कर रहे हो. We cannot keep this patient here.
Nurse, madam, nurse is also not giving us any update.
Nivedita,
Your staff is also not being helpful.
sir,
We were
can you
hoping that
allow
आप
me to
1:1.
can you allow me to see when you say something, you will have to give me an opportunity to explain you my point of view. But if both of you are just speaking and if you are not letting me speak, then probably I will not be able to explain you what.
Madam, she is my mother, ma'am. Think of
Nivedita,
that.
I want to tell you this. You said that nobody is updating. As a protocol, we update the family 2 times in a day. I can show you records. Maybe you were not there or Mehul was not there, but I have records. I can show you the patient's case field. See, yesterday there was somebody called Mr. Ashok. Must be one of your relative or friend who was there when we called for updating. And then we explain every day. And as I said, I met Mehul
मैडम
yesterday.
वो अशोक को इसके लिए भेजना पड़ा क्योंकि आपके बिलिंग वाले मेरे को नीचे बिलिंग के लिए लेके
I
गए.
know.
So what do I do? Your
But
hospital
I
just wants
always
money.
हाँ, बिलिंग के लिए बरोबर आप लोग बुला लेते हो मैम, लेकिन काउंसलिंग के लिए बुला नहीं रहे हो. ये क्या बात है?
निवेदिता, वी आर कॉलिंग ट्वाइस इन अ डे और बाहर लिखा भी हुआ है कि जब जब हम पेशेंट के कंडीशन के बारे में अपडेट करते हैं ना, तो बाहर टाइमिंग्स भी लिखे हुए हैं और जो भी उस वक्त होता है हम उन्हीं को ही अपडेट करते हैं. आई थिंक आई हैव अपडेटेड मिस्टर मेहुल कपल ऑफ टाइम्स, 3-4 दिन में मेरे ख्याल से 2-3 बारी तो.
ठीक है मैडम, आपके साथ बोल के फायदा नहीं है. वी वांट टू टेक अ पेशेंट लामा. आप मेरे को प्रोसेस बता दीजिए, मैं अपना
हाँ,
पेशेंट को
बिल्कुल
लेके जाना
बिल्कुल.
चाहता हूँ.
हम
वी आर
लोग
नॉट
लेके
हैप्पी.
जाना
वी वुड लाइक
चाहते हैं.
टू
We
गो
are not.
लामा.
Yes,
Okay.
exactly. We are not happy.
ओके, आप कहाँ ले जाना चाहते हैं, क्यों ले जाना चाहते हैं, मैं ये
I'll go
मर्जी
to the
है.
next hospital. My neighbor had taken treatment over there
Exactly.
and they were doing very well over
वो
there.
हमारी मर्जी है मैम, हम लेके जाना चाहते हैं. That's all. We are not happy with your
बिल्कुल.
way of
मैं निवेदिता,
treatment.
अगर अगर आप ले जाना चाहते हैं, आपका पूरा अधिकार है. मैं आपको रोक नहीं सकती और मैं रोकूंगी भी नहीं. लेकिन एट द सेम टाइम मैं आपको ये बताना चाहती हूँ कि जो इस वक्त उनकी कंडीशन है वो काफी क्रिटिकल है. ये मैंने सुबह भी बताया था और अभी जो जो लास्ट मैंने जब अपडेट करा है, मैंने उस पर भी सारा एक्सप्लेन करा है. और जब जैसे आप कह रहे हैं कि उनका यूरिन आउटपुट कम है, हार्ट रेट बहुत कम है, उसका उसका जो ये सीधा सीधा रीजन है वो ये है कि उनकी कंडीशन बहुत क्रिटिकल है इस वक्त उनकी. अगर आप यहाँ से मूव करना चाहते हैं, मुझे कोई दिक्कत नहीं है. वी विल प्रोवाइड यू ऑल पॉसिबल असिस्टेंस टू मूव योर पेशेंट, बट एट दिस स्टेज इट विल नॉट बी एडवाइजेबल, क्योंकि जब आप पेशेंट को मूव करते हैं तो पेशेंट विल बी रिमूव फ्रॉम द वेंटिलेटर और उसको ले जाने में, शिफ्ट करने में आपको टाइम लगेगा. आप ले जाना चाहे ले जा सकते हैं, बट इट इज ऑनेस्टली नॉट एडवाइजेबल. हाँ, अगर आप ये चाहते हैं, आपको डाउट है कि ट्रीटमेंट मैंने ठीक से नहीं, हमारे यहाँ ट्रीटमेंट ठीक से नहीं हो रहा, मैं अब आपको एक शॉर्ट समरी बना के देने के लिए तैयार हूँ. जो ट्रीटमेंट हम पेशेंट की कर रहे हैं, आप ले जाकर जहां भी जिस हॉस्पिटल में दिखाना चाहते हैं आप दिखाइए. अगर वो आपसे कहते हैं कि वो जो ट्रीटमेंट करेंगे वो इससे फर्क है, आई विल बी मोर देन हैप्पी टू मूव द पेशेंट. मुझे कोई दिक्कत नहीं है. देखिए, आई वॉन्ट योर पेशेंट्स बेस्ट. आई एम श्योर यू ऑल्सो वॉन्ट योर पेशेंट्स बेस्ट. आप किसी से मेरी बात कराना चाहते हैं, आपकी फैमिली में अगर कोई डॉक्टर है, आपके कोई फ्रेंड सर्कल में डॉक्टर है, आप मेरी उनसे बात करवाना चाहते हैं, मैं उनको एक्सप्लेन करने के लिए तैयार हूँ कि हम क्या ट्रीटमेंट दे रहे हैं. जो भी इस केस में स्टैंडर्ड ट्रीटमेंट प्रोटोकॉल्स होती हैं वो हम सब फॉलो कर रहे हैं. I understand your state. It is very difficult when you see your parent lying on the almost like deathbed. I understand completely. But I assure you, whatever needs to be done is being done. I can assure you that. And I'm ready to speak to any one of your doctor. I'm ready to give you a summary for second opinion. If you want to still take the patient, I'm ready to cooperate even for that. But if you ask me, like you were asking Archana, if it was your mother, what would you have done? I would say the same thing. I won't move her unless I'm very sure that that's going to benefit her. At least
Madam, I
whatever.
think the care is compromised, madam. I think your nursing staff is not adequate. आपके पास अंदर nurse रहती नहीं है. The patient is lying over there like that and trying to ask for something and then nobody is there. उधर अलार्म बजते रहता है. There is nobody over there to attend. I am worried. आई एम स्कैर्ड कि कल रात को कुछ ऐसा कुछ हो गया. हम लोग को तो अलाउड नहीं है अंदर 24/7. वरना एक काम कर दीजिए मैडम, हम लोग को अंदर बैठने दीजिए 24/7. वी विल सिट नेक्स्ट टू आवर पेशेंट इफ यू डू नॉट हैव स्टाफ एंड दैट इज अ प्रॉब्लम.
मैं आपको यहाँ पर एक बात बताना चाह रही थी. आईसीयू में जब पेशेंट रखा जाता है तो उसका पर्पज ये होता है कि पेशेंट को 1-on-1 केयर मिलती है. जितने पेशेंट्स होते हैं उतनी ही नर्सेज हमारी हर वक्त होती हैं. दे विल बी मूविंग अराउंड बिकॉज देयर इज लॉट ऑफ बैकग्राउंड वर्क ऑल्सो टू बी डन फॉर द पेशेंट केयर. But all the time, patient's condition is being monitored. और जो भी इमरजेंसी होती है उसको बहुत प्रॉम्प्टली सब अटेंड भी करते हैं और दे लुक आफ्टर ऑल्सो. बिहेवियर वाइज में हो सकता है कि कहीं कभी कोई स्टाफ बहुत उतना कॉर्डियल बिहेव ना करे. I can understand that. कई बारी they are also overworked and they are looking after lot of emergencies. I cannot, I mean, of course, that part also I can, look after and I can speak to my staff if that's what is bothering you. But when it comes to your patient's care, I would request you not to equate the staff's behavior with the patient care. In care, we do not compromise. We cannot. Why should we? You want your patient to be safe. We also want your patient to be, fine and going back. The kind of efforts we are making is to make sure that your patient recovers. I would request you to talk to your family, whatever we have discussed, share this discussion with them. And even after that, if you think you want to move the patient, I won't say no after that, because after all, it's your right. It's your right to see your patient's benefit. I'll cooperate with you in all possible ways. Is that okay? Thank you. Can I request everyone to come in?
I think I am the most inexperienced doctor here now.
Archana is perfectly all right. I think that is why I decided to give.
Patients are the babies, no? So that's why.
I deliberately chose you. Had I chosen somebody else,
Nobody will shout on us generally. इतना हल्ला मचा है तो अभी तक मैंने नहीं देखा ICU में, because most
I
of the
faced.
no, because our
I
this is
faced.
a NICU, like there are very small babies, so ज्यादा हल्ला मचाना नहीं होता है. तो
Then, madam, in Western Odisha, the peoples are like that way only. And Central Odisha, they are very sober, very calm and quiet. They understand. But in Western Odisha, ना थोड़ा दादागिरी टाइप की हो जाती है वहाँ पे.
पर
I
उसको
face.
कैसे हैंडल करना है, निवेदिता, I think that is what we have to learn.
Yes.
I think that's what. See, you have no control on the type of patients you will get. But if you know how to handle that, most of the times you will be able to manage it well. Most of the time. And then at the same time, sensitizing your staff to behave well, especially guards. Hours, trust me, that's going to really upset them.
That's main thing.
Exactly.
Security जो तरीके से बोलते हैं ना,
वही
हाँ बस वहीं पे खुंदक, हाँ वहीं पे काफी हो
I can see 3 hands raised. Okay, Dr. Priyanka, yes, and after that, Dr. Siyog, and then Dr. Mariam. Go ahead,
Just
Priyanka.
1 minute. Yeah, about security, same way, very polite security you will remember always. So that is one thing. And with an angry patient, I have seen, just we can say, I am sorry. We may not have done anything wrong, but when they are so agitated, I am so sorry you are feeling that way. And it must be hard. When samajh sakti hu, it is hard. I don't understand what you're going through, but it will be hard. Just sometimes these 2 words, when we say I am sorry, this thing automatically by body language, both the angry relatives calm down. Even though they wanted to be more aggressive, they could not in the second scenario. They just calm down here.
Yes, Dr. Siyog, go ahead, please.
Since this is the role play, so yes, things are actually very much controlled, and Dr. Mehul or they must be having their preconceived notions, but sometimes patient, rather than talking, the first they will talk with their hands. In that situation, then yes, because I have been in that receiving party, so I know what things and how it goes wrong, and they will not speak. They will first be physical, and then they will talk.
Dr. Siyog,
yeah.
That's why this program is all about handling difficult situations. 6 onwards, session 6 onwards, up to 10. We are going to talk about how do you handle aggressive patient party. But I want to remind everybody, which otherwise I would have talked at the end when I would say handling aggressive patient party. Nobody becomes physical all of a sudden. There will always be some sign. Problem is either we don't identify or we don't attend those signs. And if somebody is agitated and if I'm not able to identify, I'm calling for a problem. So being responsible, communicating effectively, documenting my communication, making my staff behave well is my responsibility. So time has gone when I could behave the way I like. If I wanted, I would talk. If I wanted, I will not talk. And then expecting the patient to behave well, I think we are out of that era now. We are now accountable. We are now responsible. We have to talk to them properly. We have to update them on regular basis. We have to address their concern. Usually before they hit us, they raise their concern. Unfortunately, when we don't handle them, I'm sorry to say, although Archana, I really applaud your courage to take this challenge, and I deliberately gave you that responsibility because I knew the way Archana was talking, according to her, that was the best way she could talk, but she was actually aggressive. She said, बड़े डॉक्टर से बात हो ही नहीं सकती है, मेरे से बात करिए जो बात करनी है. जब मैं ये बोलूंगी, मेरे जो सामने वाला कहेगा आप मेरे से लाख रुपया रोज का ले रहे हो, बड़ा डॉक्टर कैसे बात नहीं करेगा, बुलाओ उसको अभी यहाँ मेरे सामने. हो गई लड़ाई, एनफ है.
They started with acting, but then it became in the flow hit.
And मुझे थोड़ा टाइम दीजिए. अगले दिन अगर पेशेंट मर जाए,
if you go to tier 3 cities, ये सब होता ही नहीं है. I mean, I'm being, because I have seen this. ये सब होता ही नहीं है वहां पर. वहां पे मुक्केबाजी से ही पहले काम चलता है.
मैं समझ रही हूँ. देखो,
and I know doctors who are there who have faced this.
I'm not denying that. Dekho, I'll tell you one thing. Physical assault is a problem. It has become a national problem and it's an international problem. Almost 70 to 80% of healthcare professionals across the world face violence. They have reported facing violence. So it's not like India's problem. It's everywhere now because aggression is on the rise. Expression of aggression is also on the rise. But individually, let me tell you, if we know how to handle situations, you will be able to manage most of the situations.
What if, ma'am?
So hold on. This discussion we will do when we'll talk about handling aggressive patient party. But at the same time, I want to tell you, those who are attending the program, at least I want you to go back with the idea that there are ways to mitigate the situation. If that's what I'm assuming, that people are useless and they are there just to fight, then I will not be able to handle the situation. But lot of situations can be prevented, can be controlled, can be managed if we know where to draw the line and how to communicate and how you handle those. So you thought it is the role play that made Dr. Mehul and Nivedita to keep quiet. That's the way we have to communicate effectively in a manner where even if they wanted to be rude, because we all mirror each other's behavior. As a human being, we have that inbuilt way of behaving. We like to mirror each other. If patient acts aggressive, I act aggressive. But if I remember, I don't have to mirror my patient's behavior. And if I behave in a more mature manner, the patient will start mirroring me. That is what I did with Dr. Mehul and Nivedita. They were very aggressive with Archana. Not that they respected me. I told them very clearly, you can be as aggressive as you want. But I knew if I will not mirror their behavior, they will have to mirror my behavior. It's an art. Honestly, it's an art. Once you will learn, once you will implement, a lot of situations. And if you sense violence anywhere, my dear, the first point is safety. First point is safety. When you see danger, make sure you and your staff are safe. And there are some precautions you need to take. We'll be talking about it when we discuss how to handle aggressive patient party.
Madam, day before yesterday, somebody came to my cabin, okay, taking a bill, 2 bills, and came to my cabin about the payment. Fine. We did a PTCA case, and PTCA for walking patient, we have a package, and for TPA case, we have some other package. Okay. So while explaining them, we never knew that they are TPA case. So we explain according to working patient. Then they came to us and told कि change करो मेरा Star Health का है package. Okay. So naturally Star Health what MOU we have signed with them, we made accordingly. वो आके प्रॉब्लम कर रहा था पहले, ठीक है. फिर मेरे केबिन पे आए, मेरे केबिन पे आके प्रॉब्लम के साथ वो जो वीडियो कर रहा था मैंने देखा नहीं, ठीक है. जो मेरे सबऑर्डिनेट थे वो आके देखी और वो आके तुरंत बोली, मैडम आपका तो ये वीडियो बना रहे हैं. विदाउट मतलब नोइंग मी, ठीक है, मैं जो एक्सप्लेन करूँ वो वीडियो बना है, आई गॉट वेरी एग्रेसिव, बट मैं अपने आप को कंट्रोल किया एंड आई टोल्ड कि सर एक्सक्यूज मी, प्लीज गो आउट ऑफ माई केबिन, लेट माई सीनियर कम, ही विल टॉक, प्लीज मूव आउट फ्रॉम माई केबिन, क्योंकि मैं जानती हूँ और बहस करूंगी वो वीडियो वैसे ही कर रहे हैं, तो मैं तुरंत बोली कि आई एम नॉट गोइंग टू टॉक टू यू फर्दर, प्लीज गो आउट ऑफ माई केबिन, मूव आउट ऑफ माई केबिन एंड लेट द सीनियर कम्स। लेकिन मैं बहुत गुस्सा हो गई थी, बहुत गुस्सा हो गई, विदाउट आस्किंग, विदाउट नोइंग, व्हेन आई वाज एक्सप्लेनिंग देम एंड दे वर डूइंग माय वीडियो.
So that's what I'm saying. If you're more mindful, you will know even handling those situations in a different manner. You will be able to do. See, nothing happens all of a sudden. Once you will start working on your way of handling situations, slowly you will see things changing, and you will see the way you will handle the outcome will be very different. I think that is the crux of this story. So what I want to do here is, first of all, my apologies for sending that communication style questionnaire very, very late. I'm sorry, I was very dazed today. I came back last evening from Hyderabad, and it's back to back. I'm traveling, so I should have sent it in the morning or maybe day prior. So maybe you can all do that questionnaire right now. I could see only 5 answers. Let me check how many answers I have with me now. Those who have not done, please take 2 minutes time and do it. I just have 5 responses. So I request all of you to take 5 minutes and do that questionnaire. But please remember, after every 5 questions, you have to write the total score of those 5 questions. Write in the box and also note down those scores. So those who have done, have you noted down these scores with you? Okay, great. So I request all others to take 5 minutes and complete this so that we can have discussion around it. So those who have done, they can put their scores in the chat box with the comma in between. Yeah. So Dr. Neha, you did it, but you did not know. You can do it once again, Dr. Neha. You need not submit the Dr. Priyanka, not just 11, comma, and then write all 4. Sorry. Yeah, Mariam has done it, right? Correct. I request all others to. Dr. Praveen, score will not be like this. It will be like it's 3.2. I don't know what exactly is that.
Total, no point. Something probably comma की जगह मैंने point लगा दिया है. 12 is the total score. By question wise, first question is 4, second 3, 2, 2, 1.
No. So it will be total of 5 questions, their total, then 6 to 10, second set of questions.
Oh, I only saw one set of questions. So,
No,
sorry.
there are 20. You can do it, no problem. There are 20 questions. There will be a total 4, final scores. Yes, Mariam, go ahead, please. Yeah.
Yeah, regarding the role play, was it the tone of her voice or the way she told that she can't bring the senior person? What was
everything? So I will be telling you all 3, aspects of communication. One is your language, second is your paralanguage, and third is your body language. I'll explain you. Let's first have this course. I will explain all 4 styles and then I'll tell what is the right way of handling the situation. Thank you for asking that question. Thank you. So, Dr. Praveen, I'm deleting that score of yours. Is that okay?
Yes, please.
Okay, yes.
Hello, ma'am.
Yes, please.
Ma'am, somewhere my score is 4. Okay, I have to total count it, ma'am.
So for first 5 questions, question number 1 to 5, you have to add your score and write in the box.
Box. Okay.
Then section, after every section, there's a small box where you have to enter this course.
Okay, ma'am. Okay.
And then from question number 6 to 10, then
Yeah.
11 to 15, and 16 to 20.
Okay, ma'am.
सत्यपाल और अनस, are you doing? आप कर पा रहे हैं सत्यपाल?
यस मैम, मैं कर रहा हूँ मैम।
करके आप भी अपना दीजिएगा। और आप क्योंकि अगर वीडियो आपकी ऑफ है तो मैं भी भूल जाती हूँ कि आप हैं। अच्छा होगा कि आप वीडियो ऑन रखें, और कुछ पूछना चाहे बेझिझक पूछिए, हिंदी में पूछिए, मुझे कोई दिक्कत नहीं है, मैं तसल्ली से जवाब दूंगी आपको।
मैं हूँ मैम, मैं शुरू से हूँ कनेक्ट।
जो हम डिस्कस कर रहे हैं समझ आ रहा है? और मेरे ख्याल से आपको भी बहुत ऐसी सिचुएशंस हैंडल करनी पड़ती है।
मैम हम लोग तो कंप्लेंट ऑफिसर का भी रोल प्ले करते हैं, तो ज्यादातर पेशेंट पहले हमें ही अप्रोच करता है, उसके बाद हम फिर डॉक्टर से या अदर स्टाफ से अप्रोच करवाते हैं।
बिल्कुल बिल्कुल। तो आपके लिए तो बहुत यूजफुल रहेगा सेशन।
बहुत बहुत मैम।
जी
मैडम।
If someone takes advantage of me, I find a way.
So I've received 7 responses. One, two. I think Neha, you could not note your scores, I think. Am I right?
Hello, ma'am. I have not redone it. I am into something. I will do it. I have already sent it. Huh?
Yeah, I remember you have done it. I saw your scores. Give me a second to tell you your scores. Yeah.
Yes, ma'am.
So Neha, you can note down 12
Okay.
and 6
Okay.
and 11
Okay.
and finally 20.
Okay, ma'am. Fine. Fine. Thank
Then,
you.
yeah, you can put them in the chat box also.
Yes.
So everybody can
Yes,
see.
ma'am. I'll do that. Yeah. Yeah. Okay.
Ma'am, if you can confirm mine also, please.
Yes, your only thing is it was 5, 6, 5, 20.
5, 6.
5, 6, 5, 20. So there's just one number change, no problem. It's more or less same.
Yes, absolutely. I knew that. Yeah, 5, 6, 5.
But one of the very rare scores. You can see it for yourself.
Madam, did you
Yes,
receive
yes,
my
ma'am.
one?
Yes.
Did you receive my one, ma'am?
Nivedita, I think, acha, you have done it
Yeah, ma'am.
just now? Give
Yeah,
me
ma'am.
one second. Give me 1 second. Yeah, I've received. So you have noted yours or no?
No, ma'am. Sorry.
Oh, is it?
Yeah, ma'am. I didn't notice.
Okay, let me tell you quickly. Yeah, 14
Yeah.
and then is 16,
Yes.
11.
पीछे भी भाजी वाले हैं, कभी मैं नहीं हूँ तो लेके आने
Neha,
का।
sure.
नहीं, अभी नहीं, सुबह। अगर तुमको लगा कि मैं एक नींबू भूल गई कुछ, तो इधर नीचे कैसे जाएंगे? इधर
नेहा, आपकी भाजी की बातें सारी सुनाई दे रही हैं। सॉरी, मैं कहाँ थी?
हाँ मैडम बताए 14, 16, 11 and 40.
Finally 20.
20, sorry, 20.
20. So now I think we have most of these scores here and we can discuss.
Do you want us to put down the scores on the chat box?
Yeah, that will be better, no? Then we can
Oh,
look at
I missed that out. Okay. I'll put it down right now.
Sure. Yeah. Go ahead, yeah. Okay.
There were 4, right, madam?
Yes, 4 final scores, yeah. Yeah, 13, 14, 15, 15. Dr. Mehul, you have done it earlier also. Check your scores. Compare it with the old.
Okay.
You have
Yeah.
done it twice. You've done it
So
twice.
first 3 should be single digit and last one should be high.
Thank you. Okay. So see, we all handle such situations in primarily 4 different ways. One is we become quiet and we are okay with whatever the patient party or somebody who wants to do. It could be your colleague, it could be your senior, it could be your family member, it could be a patient or patient's family. So a lot of us just take a stand where we don't take any stand. And that style of communication is called passive communication. So your first scores are your passive communication style score. You can note down in front of your first scores.
So how do we interpret it if say my score is 11?
That means in a lot of situations you would be quiet and you would not share your thoughts or your opinion or something that you want to, you may not agree with what is happening or what the other party is saying, but you would just choose to be quiet. So if that's the way we do it once in a while, I think it's perfectly all right. That means there are situations when we think there's no need to take a stand. We can just be quiet and let them do the way they are doing. But if that's my regular way of handling, if that's my primary way of handling, then it is not really very useful. So if I may ask all of you to, to tell me if somebody is using passive style of communication on regular basis, what is the disadvantage? Briefly, each one of should give, speak just one point. If somebody is using passive communication style on regular basis, what will happen?
You're not respected and you're taken for granted.
Okay, you are not respected, you are taken for granted. Yes, Mariam.
After some time, you'll get frustrated with this.
After some time, you will get
Yes,
frustrated.
resentment and all.
There will be resentment, definitely, because you don't have any standing anywhere. Absolutely. What do others say?
You will take a lot of stress
You will be in a lot of stress because you are not happy with the way
voicing your, oh, yeah,
you feel
Your
suffocated.
work,
Yeah.
your work will not be noticed.
Your work will not be noticed. I mean, people can even exploit you. They will take the credit of what you are doing because they know that you will not voice. Absolutely. What do others say?
People will assume things about you because you're silent.
Yes. A lot of time people will just assume things just on the basis of what they think it could be. Absolutely. What do others say?
Miscommunication.
Miscommunication. Lot of scope for miscommunication. At workplace, if that's the way I work, when I'm usually a very passive communicator, not only work will not happen, but also it will hamper an individual's growth. So if anybody is communicating in mostly passive manner, chances are even the work will not happen. So that's not a very desirable kind of a communication style. Even if you have staff who are passive communicator, which to you might appear, oh, very nice, this person does not speak, and they would take whatever I say, that's not also a very good arrangement.
Taken as granted, ma'am.
Sorry?
Taken
Yes.
as granted.
Yes, not only they will be taken as granted, sometimes very vital information may not come to you just because they are not, in habit of coming up to you and sharing their concern. Yes, Dr. CEO, you wish to say something.
Yeah, they will be often be misunderstood by their colleagues and by their senior staff, and
Absolutely.
ultimately it would hamper their professional as well as their personal growth.
Absolutely. Absolutely. Growth will not happen. Personal satisfaction will be missing. Confidence. How about confidence? It'll go down.
Absolutely, yes.
What about self-esteem? It would be low. So definitely a person's image in society and personally also will not be really very meaningful. So your first score is passive communication style score. The second score is passive aggressive communication style score. Now what happens in passive aggressive? To look at the person looks passive, quiet, but that person is actually not quiet and not peaceful.
I have a doubt. In the
Please.
first set of questions, the first one is I find it difficult to say no to others, including my patients. So agree strongly is 4.
Yeah.
Yeah. So and even so that means a higher score means you are. Is it not the reverse?
No, if you are not able to say no when you need to say no, that means
Agree
you are
strongly.
submitting to people. No, you are subjugating to
Yeah.
people.
So I find it difficult to say no. The score of 4 is for agree strongly. Yes, I find it difficult to say no. So the higher score in this category means that that's the person who is sitting quietly and
Yeah, passive. Because when you need to say, for example, now the family wanted to go Lama, and I need to talk to them and explain to them that why going Lama is not a good option. But I say, that's your call.
so that means out of the score 16,
Hmm.
which is the maximum in these out of 20, the higher score would mean is.
So that's one of the, if somebody has say 14, 15 on passive, I can see some people have, for example, let me
So
see this.
lower score is better. A lower score is better in this
Yeah,
set of.
yeah, absolutely.
that
So,
question I took it as if someone is giving me some responsibility.
mhm.
So how to deny that responsibility whenever someone is asked? So that's why that is no to that. So that is how I say I strongly agree.
No, that
If
is
someone
when,
is asking, which I am, say, for example, someone says, ki, okay, I am somehow not in a position to do this duty. Can you look after my patients or something like that? I may be feeling that I'll not be able to take, but still I will agree to that. Okay, I'll take
That's
care.
my regular way of doing, agreeing to people's request. The risk is you are going to be exploited because people will know you will not say no.
Yeah.
Your seniors will burden you with responsibilities, like we say, donkey's job, because they know you will never say no.
Yeah.
So that's not advisable. There has to
Okay.
be you have to draw a line that how much can I do and how much should I do. That's the
Right.
point. Yes, Archana, you wish to say something. Go ahead.
Yeah, people would never, never hesitate to ask you for help. It cannot be help always. It is always sometimes they would not, if they don't want to do that job, they will just dump it on you.
Absolutely. That's what I said, that if people can exploit the situation because they know you will never have the courage to say no. And you will never even ask for the credit. And you will even be ready to take the blame for what has gone wrong because you think others have, more right, or their needs are more important than my needs. So you are ready to subdue to their needs. That's the whole idea. The second one is passive aggressive communication style score. That is where to look at the person is quiet, would not speak up, would not share his or her thoughts or ideas, but they would go and talk ill about you or the situation or the decision at your back. So I'm sure we have people in system who would not clearly come and say no to you on your face. They'll say yes, what you're saying is absolutely right, I agree with you. But then they will go and talk at your back and they say what an idea, what a useless idea it is. What does he think of me and what does she think of me? How can she expect me to do this? She will give all good work to her favorite people and to me she'll give useless work. So you will see people always complaining or blaming or finding fault. So these are the people who would never come out in open and share their disagreement, but they will go and talk about you or the system or the program negatively. And they will also not cooperate. And when you give them some responsibility, one, they will not take responsibility. Second, even if they take responsibility, they'll find excuses to not do that. So we get to see such people in our system, and they are passive aggressive communicators. So your second score is your passive aggressive communication style score. Some people, when they are not able to handle difficult situations or they don't agree with you, they would actually come out as aggressive. Not that they will physically start fighting with you to start with. You will see a change in their facial expressions or their tone of voice or selection of words, body language. Of course, if they're extremely aggressive, then they can also become violent. They may throw things, they may hit, non-living items, or they may even hit, people around them. So your third score is your aggressive communication style score. And your fourth score is assertive communication style score. Now, what is assertion, by the way? I want each one of you to give one aspect of assertion, one by one, and very brief, because we have just 15 minutes, and I want to show you 4 interesting videos.
To say what you feel in a respectful way, and I'll give the opportunity to the person to talk, to put his view also.
Absolutely. Wonderful. Very well explained. Yes. Thank you, Dr. Praveen. Somebody else? What is
thoughts without getting aggressive?
Absolutely. Sharing your thoughts in an honest manner without being aggressive. Excellent, I think, Dr. Priyanka. Yes. Somebody else?
No.
Firm but polite.
Somebody said
Firm but polite.
So, Dr. Mehul, if I'm firm, and if it is a person who is my subordinate, if I'm firm, will my subordinate have the courage to resist my point of view?
No, may not.
Then it is subtle aggression. A lot of time we think if I'm polite and firm, then see, again, you have to use it selectively. If you want to make a point, and if you think the other person is, for example, if it is somebody who is misbehaving with me, yes, I need to be firm because I need to communicate to that person that I will not take nonsense. But if the same conversation I'm having with set of my staff members, and I'm seeking their opinion, and I'm encouraging them to talk, and I'm also sharing my ideas, and there if I sound firm, it will be, more like I'm kind of saying I'm the boss, so you have to listen to me.
Okay.
That's the point. Otherwise, I think it's right. Yes, Dr. Suyog, go ahead.
Yeah, it's also about having a win-win situation between the two parties.
Absolutely, absolutely. So the objective is creating win-win situation where everybody feels equal part of the situation. So when you use this approach, especially where the other party is at disadvantageous position, that is where you will be able to win the other party. So assertion is being able to say what you want to say. There are 5 things in it: open, honest, confident, positive, respectful. Please remember, if your communication has these 5 things, it's assertion: open, honest, respectful, positive, confident. And like all of you have already pointed out to all the points, that you have to share your thoughts in an open manner, in an honest manner. Then you also said listen to the other party. That's very important. When you make a point, like for example, if you saw me, both Nivedita and Dr. Mehul were just bombarding me with their frustration. I took a stand. I said, I'm ready to listen to you. But when you ask me something, and if you don't allow me to, explain to you, how will this dialogue happen? So one by one, if you ask me something, I can explain you, I can answer you, I can address your concern. So you have to give me that opportunity. And you saw I was not angry or annoyed or aggressive with them, but very firmly. That's where I use firmness. That's where I use firmness. But then that was only for that instance. But throughout, I was not aggressive or not, upset about the situation. If you saw my body language, I was nodding, I was listening, I was making eye contact, I was allowing them to complete what they wanted to say. I allowed them to even vent. That requires a lot of patience and practice. But once you will start practicing, you will see it plays a very big role if you allow the other person to speak. One, their thoughts are vented, they've been able to vent out. Plus, they are, thankful that at least there's somebody who's ready to listen to my concern. So your body language plays a very big role. I'll come to it once again. Satyapal, you wish to say something. Go ahead.
मैम आपने ओपन, ऑनेस्ट, रिस्पेक्ट 5 चीज बताई थी, 2 चीज मिस हो गई मैम.
पॉजिटिव और कॉन्फिडेंट.
मैम ओपन, ऑनेस्ट, रिस्पेक्ट,
पॉजिटिव. उसके बाद पॉजिटिव. Can somebody write in the chat box, please? Yeah.
पॉजिटिव एंड लास्ट मैम.
लास्ट में कॉन्फिडेंट.
कॉन्फिडेंस. थैंक यू मैम.
अगर मेरी बात में कॉन्फिडेंस नहीं होगा ना, तो सामने वाला कन्विंस नहीं होगा. उनको लगेगा ये प्लीड नहीं करना है. ये याद रखते हैं, जब आप प्लीड कर रहे हो तो आप असर्ट नहीं कर रहे हो. सो अब यहाँ पे मरियम, यू वर आस्किंग मी अबाउट द टोन ऑफ वॉइस एंड अदर थिंग्स. दिस इज वेयर आई वांट टू ब्रिंग इट. See, assertion has 3 distinct, aspects. The first one is language. So my selection of words have to be very, very, respectful. जैसे पेशेंट मुझे ये कह रहा है कि वी वांट टू स्पीक टू अ सीनियर पर्सन, रेदर देन सेइंग दिस कि इस वक्त मैं ड्यूटी हूं, मेरे से बात करो. इफ आई से आई एम रेडी टू आस्क माय सीनियर टू कम एंड सी यू, बट इफ यू कुड शेयर योर कंसर्न विद मी, I would at least give them a heads up. I will let them know your concern. And if it is possible for me to, address your concern, maybe I can help you. But in case if I feel like I will not be able to help you and I need to escalate, I'll be happy to connect you with my senior. Suppose my senior is at 30 kilometers from here. I can say, If the need be, I'll connect with that my senior on phone. I can help you with that. Or maybe if I have somebody in the system who can, talk in that moment. So selection of words is very important. मुझसे बात कीजिए. Archana, sorry, don't think that I'm finding fault with this thing, but that gave me a lot of good, मुझसे बात कीजिए. When I'm saying this, it is coming out as aggressive. मैं हूं ना यहाँ पे, मेरे से बात करो आप. उनसे वो क्या बात करनी है? So selection of it. See, I am here on duty. My job is to help you. I'm ready to help you. In case if I'm not able to address your concern amicably, I'll be more than happy to, escalate it to my seniors. Somebody will come and help you. Can you share your concern? Selection of words. Sometimes they may use derogatory language. वो तू पर आ जाते हैं. तू क्या समझती है अपने आप को? तू क्या समझता है अपने आप को? But you will never go down to that level. क्योंकि आपने जैसे ही उनके साथ इक्वेट करा, then they will further go one step down. So आपने आप ही करके बात करनी है. It's difficult, but then you have to be very mindful of your language. Yes, Dr. Seo, you wish to add something. Go ahead.
Yeah. As you just mentioned about being mindful. Yes. So I had read this concept about amygdala hijack. How a person gets angry and gets into the conflict situation. Once his amygdala gets hijacked. So one's needs to be and especially the healthcare provider, and especially dealing with such hostile situations, one needs to be very, very mindful. If you are dealing with such situations, and you just need to check.
It is not amygdala hijack, Dr. Seo.
Hijack was more than
it is your rational mind that gets hijacked by amygdala.
Absolutely.
It's your emotional mind that hijacks your, rational mind, and it starts reacting. It doesn't give you space to respond to the situation, but it's just training your mind. It's you once you learn to train. That's why when you speak slowly, and that's the next thing I was going to tell. So that language part is clear. We don't have to use derogatory language. We don't have to be disrespectful. I have to choose my words with care. And for that, I have to speak at a slower speed. The second part is paralanguage. So when I'm talking about paralanguage, first is your speed of speaking. The moment you speak faster, it comes out as aggression, desperation, defense. But if you're speaking slowly, you will be able to choose your words wisely. You will get that time to choose the right word in that situation. Second, you appear confident when you speak slowly. So tone of voice and the speed of voice have to be normal, like we talk. It can be even little lower. That brings in.
Learn from politicians. They will use 4 sentences, then pause, because with the experience, they are not in a rush. When we are emotional, we are in a rush.
Yes.
And even talk in English. Sometimes if they understand English, talk in English. So when we talk in mother, same Hindi, fir wo tu tada, and then it just goes on and on.
Yes, absolutely. So paralanguage is your tone of voice. So tone of voice should not be intimidating. It should not be disrespectful. It should not be desperation. It should be firm, but respectful. Speed of talking, as I said, it should be little less than normal. You will appear more confident, wise, and also you will be able to think and speak rather than just answering reflexively. तो बाद में जब ये लोग बात कर रहे थे, निवेदिता और अर्चना और डॉक्टर मेहुल, तो आपने देखा होगा, it came out as tit for tat answering. वही सारा कम्युनिकेशन ब्रेक डाउन हो जाता है. And nobody is listening. ना वो सुन रहे थे, ना वो सुन रही थी. But they were just answering. मुझसे बात करिए, टाइम दीजिए, सीनियर डॉक्टर की कोई जरूरत ही नहीं है. Sorry, I've written these points on my.
I am just noting down my own words now, actually.
Absolutely. So paralanguage plays a very big role. Third is your body language. In body language, first is your facial expressions. Facial expression should never look aggressive. Let it be normal, but it should not be pleading also. If your facial expressions are either pleading or aggressive, it will not communicate assertion. Then is eye contact. Always make eye contact with the person whom you are talking to. Look into the person's eyes and speak, because that thing shows you are sure of what you are saying. But again, it should not be full of anger or aggression. A lot of time we become angry and our, eyes literally, what do you call it? Bulge out. Not desirable. So just normal. Empathy can be communicated through eyes. So see if you can bring that up in your facial expressions and eye contact. Preferably sit and talk. Make the other person also sit and talk. That would relieve the, that would actually reduce the energy to fight. So you must have seen, if you want to fight with somebody, you have to stand and talk. If you sit down, your energy to fight goes down. It's always good to make the person sit and then talk. If the other person refuses to sit, it's okay if you also stand and talk. If you are sitting and the other person is standing, you will have to literally lift your head like this. So it will be tiring for your back, and that also can act as an irritant and trigger aggressive reaction. Or the other way around, if you are standing and the other person is sitting, again the posture would be affected. So make sure that you sit and talk. Your body language should be relaxed. If you're sitting like this, that shows that I'm not interested in what you're saying. Or if you have your hands like this or at the back, that again shows that you are trying to show your authority. So make sure your body language does not communicate anger, aggression, or authoritativeness. And when you sit one-on-one and talk like this, so in assertion 1, you say what you want to say, then you're open to listening to the other person. And then if you think the other person's point of view is fine and it works for you, you would not hesitate in accepting. I think what you're saying is making a lot of sense to me. Now, for example, if the same family would have told to me, we are done with the finances. We don't have money. We can't pay your bills. We need to leave. Now there I can't continue arguing. No, you have to stay. So there probably I'll say, I understand. See, in case if you have some, connections in government hospital, if you think you can take there, I mean, you can take. But otherwise, if you're thinking of taking to any private hospital, the cost would be just a little bit here and there. So it's your call. I think that's something you have to take. So that's how, when you assert, you are trying to look for solution that works for the other party and for you also. So assertion does not always get you what you want, but assertion gives you satisfaction that you communicated effectively. Rest is their call. So that gives you satisfaction, and assertion is one skill. I think if we all learn, it would not only be helpful in the professional life, but even in personal life, you will see there's a lot of satisfaction that I express myself in a more, amicable manner, confidently express. People may not agree with you. We can always come to a point and say, I think it's okay. We can agree to disagree. I'm okay with that idea also. But then you feel good that you didn't have to suffocate yourself. Because if you're not expressing, that's a very dangerous situation. So any questions about this? Okay. Your 4th score is your assertive communication style score. So I can see most of you have got highest on the assertive communication. Okay, I can see. Okay, 20. Okay, some scores are interesting, and I want to talk about that because there's slight twist in this story. So all of you must be very happy that I have highest on assertive communication style. There's slight twist in this story. So you will try assertion, and mostly you will be able to assert. But when your assertion will not work, your second highest style score will come in place. So you are more likely to use the second highest communication style score if the first score, that is assertion, does not work. So let me take a couple of examples here. Okay, Mariam, in your case, your passive score is 17 and your assertion is 18. These two scores are quite neck to neck. So you are using them alternatively. There are situations where you assert, where you think I can assert. There are situations, there are set of people where you don't assert, where you think it's not going to work and you prefer to be passive. Do you agree with your scores, Mariam?
That's right. That's how I can.
Sorry?
That's how I communicate usually.
Okay. So Archana, in your case, again, you will try assertion. You try assertion. If assertion does not work, you choose to be passive. I hope you agree with your scores because these are the answers given by you.
Yes.
Good. So Suyog, your scores are very, very interesting. I mean, very uncommon scores. I have not seen these kind of scores because your assertion is very high and your other scores are very, very low. And if that's how you handle situations, I'm sure most of the difficult situations you must be handling effectively. That's what I understand from your scores. And I'm sure you will agree with your scores.
Yes, absolutely. Most of the time, yes.
Yes, I'm sure. Yeah. Okay. So I'll take one more person. Okay, Dr. Mehul, your scores are interesting. So in your case, again, you are using all four styles. Again, depending upon the situation, the person, and your assertion score is low. Let me remind you, your assertion score is low. Your aggression scores are also high. It's as high as assertion. So you're using it almost everything alternatively. As I said, depending upon the situation, depending upon the person. I hope you agree with your scores. At the same time, you have a lot of scope to improve on assertion. If you could improve on assertion, your all other scores can go down. Anas,
That's a big task, madam. To be very honest.
I agree. I agree.
So I think more of the role play needs to be on that because it's easy to do it, but there are a lot of parts to it which I think are important. I mean, like you said, paralanguage and a lot of that. That's something very important.
Absolutely, I completely agree. Yeah, yeah. So Anas, in your case also, your assertion is low, but if your assertion will not work, you will go to being passive. See, most of the people become quiet. I couldn't see anybody's aggression scores as very high. Jayapra, in your case, I think you are assertive, and if that does not work, you would either become aggressive or you can also become passive because they're also quite close one by one. So anybody else who would like to know the interpretation of your scores? Otherwise, it's all self-explanatory, I think. Yeah, Nivedita, in your case, if your assertion does not work, you are likely to become passive-aggressive. Do you agree with your scores? Okay.
Yes, ma'am.
So let
nowadays I have been controlling myself. In that way, I'm controlling myself.
It's a journey.
I told you that
it's all.
Yeah, no. Still, yesterday's incidents only I told. Previous Nivedita, you would have shouted and I would scream on them. But just I controlled myself and I told, please move out from my cabin.
Because you remember Dr. Indu, I
Very
think.
simple way that.
Don't worry, by the end of 10 sessions, we'll be different. We all will be different. So I want to show you 4 videos. These are my, home production videos. And I have tried to display all 4 styles of communication, handling the same situation. So let me quickly show you the videos and then we close the session here and then we have 2 presentations, one by Dr. Priyanka and one by Dr. Suyog. I think only 2 of you have done it. You haven't done your presentation on time, but I have messaged you in the group that if you don't do it, you will have to record your video and then send it. But before that, you will have to get your PPT vetted by me, finalized, recorded, and send in the group. Then you can claim your certificate. Pardon me for being very strict about it. I hope you understand. So let me show you the videos that I'm talking about.
मैम हाँ जी मैम बेड नंबर 7 पे पेशेंट जाने के लिए कह रहे हैं कहाँ दूसरा हॉस्पिटल जाने के लिए कह रहे हैं उनके जो रिश्तेदार हैं क्या कह रहे हैं हम डिस्चार्ज कर दो हम दूसरा हॉस्पिटल जाएंगे वो जो उनका बेटा है जो उनके साथ जो है ना वो कह रहे हैं वहाँ दूसरा हॉस्पिटल ले जाओ एक बार आपसे बात करा दो बात कर लीजिए जाने दो क्या करना है कौन सी सफाई करेगा छोड़ो करो डॉक्टर राकेश को बोलो उसकी डिस्चार्ज स्लिप बना दे आप अपना बिल क्लियर कर लेना ठीक है बना दो डिस्चार्ज स्लिप बनवा दो
So what did you observe in this video?
Passive communication.
So could you see not interested, not taking responsibility, not taking any initiative? I don't care. I'm not concerned about patient. I'm not concerned about hospital. I'm not concerned about anything. I just want to get rid of the. I hope you could see it. Now let me show you the second video. Was the voice quality okay?
मैम आ जाओ मैम बेड नंबर 7 पे पेशेंट जाने के लिए कह रहे हैं कहाँ जाना है दूसरा हॉस्पिटल जाने के लिए कह रहे हैं केवल डिस्चार्ज कर दीजिए दूसरा हॉस्पिटल जाना कौन कह रहा है उनका बेटा साथ में जी वो जो अटेम्प्ट के साथ रहता है वो है ही बदतमीज वो बिल्कुल बेकार आदमी है हर वक्त कुछ ना कुछ उसको नया ही सोचता है अब क्या कह रहा है वो डिस्चार्ज कर दीजिए हम दूसरा हॉस्पिटल लेके जाएंगे ये तो वहां जाके क्या इनको बहुत बढ़िया कुछ वो मिल जाएगा क्या यहाँ पे इनको क्या तकलीफ है क्या कह रहे हैं यहाँ पे क्या दिक्कत है उसको कह रहे बस हमारे डिस्चार्ज कर दीजिए हम दूसरे हॉस्पिटल जाएंगे नहीं तो वहां पे क्या यहाँ पे इसको क्या दिक्कत आ रही है कुछ बता रहा है कि क्या क्या प्रॉब्लम है उसको नहीं ऐसा तो कुछ बताया नहीं कुछ बोला नहीं अरे ये शुरू से ही ऐसे ही बोल रहा है ये महा तंग करने वाला बंदा है किसी काम का नहीं भेजो ऐसे बंदे से क्या करना है हमने और लड़ाई करेगा बेटी देर ये यहाँ रहेगा तंग ही करेगा कभी मेरे पास आता है कभी कहते जी सिस्टर ऐसे कर रही है कभी कहते हैं जी सिस्टर वैसे कर रही है कभी कहते हैं जी पर्दे नहीं ठीक है यहाँ पे कभी कहते हैं जी एसी नहीं काम कर रहा आपका बार बार कंप्लेन ही करते हैं भेजो इसको डॉक्टर राकेश को बोलो इसकी वो बना दे बात कर ले जाओ क्या बात करनी है बदतमीज आदमी है जाने जान छूटेगी कुछ बोलना मत उसको कह रहे हैं ठीक है हम बना के देंगे डॉक्टर राकेश को बोलो उसकी डिस्चार्ज स्लिप बना दे और बिल क्लियर कर लेना अपना भेजो, जाने दो, ऐसे लोग जाए ना ही रहे तो अच्छा, सारा दिन से खपाई करनी पड़ती है फिर बस। ठीक है, तुम्हारा क्यों मुंह उतर गया? जाओ जाओ जाओ, जाने दो।
मैम आजा, मैम बेड नंबर।
So I hope you could see the passive aggressive style of. See again, she was not wanting to talk to the patient party, but she was talking ill about the patient and their behavior. A lot of time we don't address the patient's concern, but we just try to find fault with them and their family and their attendants. Just get that satisfaction. Oh, they are troubleshooter. I am fine. My hospital is good, but the patient party is a troubleshooter. That's how.
Like
प्री
label them.
एक बना लेते हैं ना कि
Just
वो तो है
label
ही
them.
नेगेटिव,
Not label. Yeah.
कि वो बना लेते हैं ना कि पहले से कि हाँ वो तो है ही ऐसे, तो क्या बात करना, तो वी
तो
नेवर
मतलब कोई
ट्राइड।
जेन्युइन कंसर्न भी होगा तो भी
हाँ
आप
हो
नहीं
एग्जैक्ट
करो।
एग्जैक्ट।
Dr. Priyanka, you were saying something.
Yeah, we just label people. This is troublemaker. This is always
Yes.
complaining without even understanding where the thing is, and making so many comments about the patient attender without.
And then
sometimes-
that easily gets spread to everyone.
This nurse will go and talk to another nurse in front of the patient attender, and then he will come fighting.
Absolutely.
एंड सेकेंडली मैडम, जो रियली क्वालिटी, जो पोर क्वालिटी है, वेयर वी कैन डेवलप आवरसेल्फ, वो भी
Yeah.
मिस कर जाते हैं।
तो हम
complaint
एक्सेप्ट ही
मतलब
नहीं
हम-
करते ना, we don't
वही
want to
वही
accept
क्योंकि
कि हमारे-
ऑलरेडी हम लोग एक कंसेप्शन बना के रखे हैं कि वो तो नेगेटिव देके जाएंगे, तो हो सकता है कि ऑन ग्राउंड रियली कुछ तो नेगेटिव होगा। दे आर सेइंग 100, इट मे बी 40, लेकिन है तो कुछ तो
कुछ तो होगा, कुछ तो गैप होगा।
एग्जैक्टली वही हम लोग मिस कर जाते हैं।
Absolutely. So let's watch the next video.
मैम आती हूँ। मैम बेड नंबर 7 के पेशेंट जाने के लिए कहते हैं।
क्यों?
डिस्चार्ज मांग रहे हैं, कहते हैं मैं छुट्टी कर दो, हम दूसरे हॉस्पिटल जाएंगे।
फिर क्या तकलीफ है उसको?
वो कह रहे छुट्टी करता हूँ, मैं दूसरे हॉस्पिटल जाऊंगी।
यार बहुत ही पागल आदमी है, हालत पेशेंट की इतनी खराब है, छुट्टी करो, रास्ते में कुछ हो आ गया तो क्या करेंगे?
उनके साथ जो अटेंडेंट है वो कह रहे हैं कि हमारे डिस्चार्ज करा।
उसका जो बेटा है जो उसके साथ हमेशा बैठता है, यार बहुत ही बेकार आदमी है। जब देखो इसको, पहले तो इतने नखरे इतने हैं, कभी एसी काम नहीं कर रहा, कभी ये नहीं काम कर रहा, अब छुट्टी कर दो, छुट्टी कर दो।
आपकी बात करा दी?
भेजो उसको, जरा सही करो उसको, भेजो जरा। क्या तकलीफ है भाई, क्या हुआ है?
मैम डिस्चार्ज कर दीजिए।
तुम्हें उनकी हालत पता है इस वक्त क्या है?
बहुत दूर पड़ता है, आने जाने में दिक्कत होती है, इसलिए आप डिस्चार्ज कर दीजिए।
मैं तो हॉस्पिटल तुम्हारे घर के पास ले जाऊं, डिस्चार्ज कर दो। उनकी हालत इतनी खराब है, रास्ते में कुछ हो हवा गया ना इधर के रहोगे ना उधर के रहोगे। ज्यादा दिमाग मत चलाओ अपना। इलाज करवाना है तो शांति से करवाना चाहिए, ऐसे नहीं कि इधर भागो उधर भागो।
मैम इधर आने के लिए अच्छा लगता है, और इधर आते भी बहुत ज्यादा भीड़ हो गया मैम, तो पैसे है नहीं हमारे पास।
तो पहले ही सरकारी में चले जाना था, यहाँ आने की क्या जरूरत है फिर? आधा अधूरा इलाज करके अब जहाँ जाओगे तो वो लोग तो कहेंगे ना जी ठीक से इलाज नहीं करा उन्होंने, मेरा भी नाम खराब करोगे, और रास्ते में पेशेंट को कुछ हो गया तो और मुसीबत हो जाएगी।
मैम आप डिस्चार्ज कर दीजिए।
भैया बहुत ही बेकार आदमी हो तुम तो। डिस्चार्ज तो मैं कर दूंगी, पर दोबारा मुड़ के मेरे पास बताना। ये कोई तरीका नहीं है इलाज कराने का। अपने पेशेंट का भी नुकसान करोगे और मेरा भी नुकसान करोगे साथ ही साथ में। हमारा आदमी है। सिस्टर,
हाँ जी,
इनकी डिस्चार्ज स्लिप बना दो और बिल क्लियर करो इनका, तब भेजना इनको। जाओ, और दोबारा मुड़ के मत आना मेरे क्लिनिक में। पता नहीं कहाँ कहाँ से लोग आ जाते हैं।
The
every which
person
way
who
aggressive. The language, the body language, and tone as well as all the three.
एंड इवन सोचे भी नहीं कि जिसको बोल रहे हो उनके मेंटल स्टेटस क्या है, वही रीड नहीं किए पहले कि मेंटल स्टेटस में एक बंदे क्यों आके बोल रहे हैं कि मैं अपने पेशेंट की इस हालत में ले जाऊं। तो पहले तो उनके मेंटल स्टेटस तो देखो क्या है, द वे इट वाज टोल्ड टू हिम। तो वो तो एक तो घबराया हुआ है और एक टेंशन में भी है, मेरा पेशेंट का क्या होगा, ऊपर से खर्च, सब कुछ मिला के तो वो मेंटल स्टडी नहीं किए।
तो जब पेशेंट को हम कहते हैं ना ये पैसे और जमा कराओ, तो उनको तभी ये लगता है कि हमें तो बोला था 1.5 लाख लगेगा, अब ये कह रहे हैं 1.5 लाख के बाद ऊपर भी 50,000 मांग रहे हैं। फिर उनको लगता है वी हैव बीन चीटेड, बिकॉज स्पेशली अगर हमने उनको एक्सप्लेन नहीं करा हुआ, बताया नहीं हुआ, प्रिपेयर नहीं करा हुआ, तो उनके लिए बहुत बड़ा बर्डन है। यस डॉक्टर सीओ, आई थिंक यू वांट टू से समथिंग।
It was a clear cut of example of antipathy. The one thing that you mentioned in the first session.
एब्सोल्युटली, एब्सोल्युटली। हॉस्पिटल तुम्हारे घर के पास ले जाऊं क्या? कुछ हो गया तो कौन जिम्मेदारी है? वापस मत आना मुड़ के कभी। And we have seen people talking like this. I've seen people talking like this. Now let's see, could we handle this situation in a different manner? So these videos are made during the COVID time, you know.
मैम आ जाओ इसमें। मैम घर नंबर 7 जाने के लिए चाहिए।
कहाँ जाना चाहिए?
दूसरा हॉस्पिटल।
छुट्टी के लिए कह रहे हैं?
हाँ जी।
जो उसका बेटा जो साथ में वही होता है उसका। भेजो उसको नाइट वाले से बात करो। भूपेंद्र नाम है ना आपका? आप उनके बेटे हैं जी। क्या हुआ इनका? जी मैम डिस्चार्ज कर दीजिए। कहाँ ले जाना चाहते हैं? जी मैम किसी दूसरे हॉस्पिटल में जाएंगे जो अपने घर के पास में होगा। वहां से आने में बहुत दूर पड़ता है और जो पैसा है उतना है नहीं, मेरे आने जाने में खर्चा बहुत हो जाता है। देखो बेटा, अगर आप कहोगे छुट्टी कर दो मैं कर दूंगी, मुझे कोई दिक्कत नहीं। पर मैं आपको ये बताना चाहती हूँ कि इस वक्त उनकी हालत जो है वो लेके जाने वाली नहीं है। क्योंकि एक तो जैसे यहाँ से अगर आप लेके जाओगे तो रास्ते में एम्बुलेंस में लेके जाओगे, कैसे होगा कुछ नहीं कह सकते, क्या सिचुएशन है कुछ नहीं कह सकते। मतलब हालत इतनी अच्छी नहीं है, ठीक है। थोड़ी भी ठीक होती तो मैं कहती चलो ले जाओ, कोई बात नहीं। तो एक तो सबसे बड़ी बात ये है। दूसरा ये देखो बेटा, जैसे पिछले हफ्ते से हम लोग इलाज कर रहे हैं, जिसमें काफी हद तक उनके बारे में पता है क्या उनकी कंडीशन है। अब नए हॉस्पिटल जाओगे, नए सिरे से वो इलाज करेंगे। मैं बेशक तुम्हें पर्ची बना के दूंगी, उनका सारा डिस्चार्ज लिख के दूंगी, जो जो ट्रीटमेंट करनी है। फिर भी एक होता है, एक डॉक्टर जो ट्रीट कर रहे होते हैं उनको पता होता है कि इस वक्त इनके किस दवाई से इनको फायदा हो रहा है, क्या इनको नहीं सूट कर रहा। नई जगह जाओगे तो फिर वो नए तरीके से सारा हैंडल करेंगे। तो देखो एडवाइजेबल तो नहीं होता बार बार डॉक्टर चेंज करना। और मुझे ऐसा भी लग रहा है कि पिछले 2-3 दिनों में थोड़ी, अगर आपने नोट करा तो उनकी कंडीशन में इम्प्रूवमेंट भी हुई है ना। इम्प्रूवमेंट तो हुई, बट वही पैसे वाली प्रॉब्लम आ जाती है। पैसे देखो बच्चे, ये तो मैं मानती हूँ कि प्राइवेट में तो खर्चा आता है, अगर जहाँ भी लेके जाओगे वहां भी खर्चा तो आएगा ही आएगा, ऐसा तो है नहीं कोई फ्री में हो जाएगा। अच्छा सरकारी में अगर जाओगे तो वहां पे आपको पता है वहां पे इतना पेशेंट होता है कि आपके पेशेंट को बेड मिलेगा नहीं मिलेगा कुछ गारंटी नहीं है ना। देखो मेरे से पूछोगे अगर तो 2-3 दिन की बात और है, जहाँ इतना सह लिया ये भी आप करें। बहुत मुश्किल है, लेके जाना चाहते हो फिर तो बेटा मैं जिद तो नहीं कर सकती तुम्हारे साथ में, तुम्हारा पेशेंट है, तुम्हारी फादर है, तुम्हें डिसाइड करना है कि क्या करना है। जो भी करना चाहो तुम कर सकते हो। पर मैं कहूंगी ये कि घर पे एक बारी सलाह कर लो, अपने बाकी जो लोग हैं उनसे बैठ के सलाह कर लो। कि मेरा कहना ये कि सिर्फ 2-3 दिन की बात और है, जहाँ हफ्ता निकल गया सिर्फ 2-3 दिन की बात है। फिर भी कहोगे तो मैं कर दूंगी छुट्टी, मुझे कोई दिक्कत नहीं। मैं पर्ची बना दूंगी, पता कर लो जहाँ बेड है, जहाँ खर्चा कम है, फिर जाने ले जाओ। वैसे आपने तो सही कहा, वैसे एक बार जाके घर में मैं डिस्कस कर लेता हूँ मैम,
और पता करता हूँ कि 2-3 दिन की और बात है और इम्प्रूवमेंट भी अच्छा हो रहा है उनका, तो शायद हो सकता है कि खर्चा थोड़ा एडजस्ट कर लेंगे तो हो सकता है सही हो।
देखो बेटा, हॉस्पिटल में खर्चा तो होता ही है, ये तो है नहीं कि फ्री कहीं काम होगा। वहाँ सरकारी में जाओगे तो वहाँ टाइम ज्यादा लगेगा या बेड नहीं मिलेगा। प्राइवेट में जाओगे तो 19-20 का फर्क आएगा। ऐसा नहीं क्योंकि जमीन आसमान का अंतर। फिर भी आप सलाह कर लो, मुझे बता दें, ठीक है?
थैंक यू।
अच्छा जी।
So these videos were recording during the COVID time, and nothing was scripted. Even the patient's attendance, whatever that person spoke was not scripted. But you can see how navigate the whole communication. We think it's the patient who starts the communication. It's we who communicate. If you will communicate effectively, automatically the other person will try to mirror you and try to, understand your point of view. So in the last video, I hope you could see the language, the body language, tone of voice, empathy. I hope you could see the empathy. And all these are essential when you are assertive.
Madam, I want to add one more thing. If it can be added, like once the patient attendant comes, greet the patient attendant. One, greet the patient attendant, and second, let them sit. When he came to your cabin, just बोले कि please be seated. क्योंकि कभी कभी पेशेंट अटेंडर सीट बैठते नहीं है, तो उनको ना वो रेस्पेक्ट दे के प्लीज बी सीटेड, मैं भी बैठी हूँ ना, आप लोग प्लीज बैठिए, तो इट चेंजेस. I saw this scenario. It changes, ma'am. कि हाँ चलो आगे बंदा मुझे रेस्पेक्ट देके बोल रहा है, इस पोजीशन में है.
Yeah, the person feels respected. Absolutely. So I hope this gives you clarity on all 4 styles of communication. Some could be like we do every day. Assertion is difficult, I know. It takes time. But every day, if you start implementing just one part of it, you will see a change happening. If you have read that book, Atomic Habits, how many of you have read it? Some of you have read it. Read that book. It's a very interesting book, Atomic Habits by James Clear. It says if you implement just 1% of what you learn every day, you will be 37% different than what you are today in a year's time. And it's actually true. I completely agree. You can't implement everything, in one go, but start trying doing that. Like you said, greet the patient, make them sit, ask them. The first question, if you ask, why do you want to take and where do you want to take? That itself will give you a reason why the patient or the family wants to take the patient. I mean, there's no need for all that discussion. Talk to me and tell me, just say, why do you want to take and where do you want to take? What is your concern? They'll come to the point and they'll start sharing. So I hope this whole discussion helps you in handling difficult situations with patient party. I mean, there's no one-line answer for any situation, but this gives you food for thought to work on your communication. Any questions about whatever we have discussed in today's session? Or anything you wish to say or comment or feedback? Written feedback तो आप देते नहीं सेशन का, तो बहुत मुश्किल है देना, सबके पास टाइम ही नहीं है, तो इसलिए रिटर्न फीडबैक कोई नहीं देता. कभी कभी आपको एक बात और बताऊं रिटर्न फीडबैक के बारे में. सॉरी, मुझे पता है टाइम कम है, बट इट्स इंपॉर्टेंट बिकॉज फॉर मी दैट्स अ पेन पॉइंट. सो आई हैव टू कम्युनिकेट टू यू एंड आई एम यूजिंग ह्यूमर टू कम्युनिकेट माई पेन पॉइंट. तो एक बार ये अकबर ने बीरबल से कहा कि मुझे ये देखना है कि मेरे जो राज्य के लोग हैं वो कितने ईमानदार हैं. इज इट ओके इफ आई स्पीक हिंदी? ओके, थैंक यू. तो उन्होंने कहा, अकबर ने कहा बीरबल से कि मुझे देखना है कि मेरे राज्य के लोग कितने ईमानदार हैं. तो बीरबल तो बहुत ही हाजिर जवाब थे, बहुत दिमाग वाले थे. ही सेड कोई दिक्कत नहीं सर, अभी पता लगा लेते हैं. उन्होंने कहा जो बाहर तालाब है ना राज्य के बाहर, उसको खाली करवा दीजिए. तो चलो उन्होंने कहा, अपने लगा दिए, सेवादार लगा दिए और सारा तालाब खाली करा दिया गया. और फिर अनाउंसमेंट करवा दी कि हर कोई उस तालाब में 1 लोटा दूध डालेगा, ठीक है, हर कोई उस तालाब में 1 लोटा दूध डालेगा। तो अगले दिन सुबह जब अकबर और बीरबल गए तो वो पूरा तालाब जो है वो पानी से भरा हुआ था। हर एक ने ये सोचा कि बाकी सब लोग तो दूध डाल ही रहे हैं, अगर मैं पानी डालूंगा तो क्या फर्क पड़ता है। तो 15 के 15 पार्टिसिपेंट्स ने सोचा बाकी 14 लोग तो फीडबैक दे ही रहे हैं, अगर मैं एक फीडबैक नहीं दूंगा तो क्या फर्क पड़ेगा, मेरे फीडबैक से क्या फर्क पड़ता है। I wait for 3 days. I leave my that file open, feedback file, because I read every feedback very carefully. Some of you are continuously writing, please discuss handling aggressive patient party. And I'm reading that because that's one of the topic I'm going to cover. Trust me, I read your feedback very, very carefully. I want to make the program very meaningful, very useful for all of you. You are investing so much of time. Late evening, 8 to 10 is not easy to sit in front of your camera. We can make it more meaningful, more useful. Give your feedback. Thank you.
Madam, daily you are changing us, ma'am. I myself will say that daily after training, I'm getting changed day by day. Before this training program, I was something else. I can say myself, I was something else the way I used to say, okay. But now, slowly and steady while speaking, also, believe me, I keep some point in my mind, back of my mind while speaking. So this can be noticed by my staff also, ma'am. The today Nivedita madam is speaking the way she keeps herself so, I mean, very, like I control myself. Previously, I was not that. So, what feedback I will give you? Because every day I'm improving myself. From this training program, I'm daily improving myself, ma'am. So,
Thank you for
giving your marks.
अगर ये एक कमेंट
Madam, I cannot give you the marks, ma'am.
But that form would give madam more boost up, I guess. Nivedita ma'am.
मैं इसीलिए 24 घंटे का टाइम देती हूँ।
No, really, believe me, I cannot.
Ma'am, I finished the feedback
There is a marking
immediately.
also.
You have not received?
I have received. That's what I'm telling. Those of you who are writing, I'm listening to your, reading your feedback. Last time also, I received only 3 feedbacks.
I cannot give marking, madam. That's the main thing. Sorry, but I cannot give marking because daily I'm improving from yourself. There is no marking.
Thank you. Thank you
from
for
my
your
side. No
feedback.
marking.
I think that's a very, 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 huge compliment to me. If you see yourself changing, what more I can want? But more.
And for that, even my colleagues, my boss, everyone has noticed that, and you know that better than me. They called you up for the training program, so you can understand what will be the feedback.
Thank you, Nivedita. I think you have made my day. Thank you, Dr. Praveen. There was some child with you. Who's that?
My granddaughter.
I was about to ask you. Then I thought, if it was your daughter, you will say, "What do you mean? Have I that old?" Because you don't look that old.
The last Thursday I could not attend because I am blessed with grandson also now. My daughter is with me only.
Congratulations. So मिठाई तो बनती है ना?
बिल्कुल बनती है. But how can I send it like this?
Congratulations, sir, from my side also.
Thank you.
So I hope the daughter and your grandson both.
And that is why I did not give feedback. Otherwise, I am giving feedback every time.
Some of
because I had not listened. I had not listened to the talk. No, so how can I give feedback? So when I read that, again listened, then I communicated today what I was feeling about that.
Wonderful. Thank you. So, so if when you give your feedback, I feel, I get the light idea that I need to work on that area. And I'm open to listening to your negative feedback also. Not that I'm looking for praise. Whatever suggestions will come from you, that will be with the idea to better our program. It would benefit all of us and it will benefit the future, audience. That's the whole idea. But thank you for the lovely words that all of you have shared with me. So I think we have 2 presentations. I know it's 10, but you will all have to be here. 15 minutes. I think you both will be able to finish in 7-8 minutes, Dr. Priyanka and Dr. Suyog. Okay. So ladies first. So
Okay,
Priyanka.
shall I share
Yeah.
my screen?
I'm giving you the option. Yes, now you can. Yes, you can share. Dr. Suyog wants to say something?
Yes,
Okay.
absolutely. Ladies first.
Okay. So Dr. Suyog, you were not visible. The whole picture was very blurred. Even you were not clearly visible.
Is my screen visible?
Yes, we can see it. Absolutely.
Okay, so I will start without wasting time. Let me just put my timer, so I will stop. So thank you all. Thank you, Dr. Indu. I am Dr. Priyanka, gynecologist, participant in this very amazing program. Ice-breaking activities are kind of activities which are important when you start programs. It brings in like a sense of community, and the participants are getting to know each other, especially in a platform like this where we are all sitting in different cities, working in different hospitals. It kind of brings very friendly atmosphere. So like I would just want to start with something like this. You would have seen this. This would be icebreaker activity, which is when we are, say, in a common hall or we are all together. So this was also a video which was viral some time back. And this is again like ice-breaking activity on communication. So you can just see the person who is starting the program has kind of involved everybody. They are all standing. They have to, like we had the session in which we had the ICU note being circulated from one person to the other, how we missed the communication. So this is starting of ice-breaking activity where they start the session with different kind of physical gesture. And by the end of the session, we can see that the thing is totally lost. But it kind of brings everyone on the same platform, and people are, they mingle with each other. It becomes kind of easy for them to talk to each other. So it's a game or activity used to introduce people to each other so that they are more relaxed with each other. The types of icebreakers are either people, where we are asking them about themselves, say, what is your name, and tell us something about yourself, or based on a topic, or even based on activity like you just saw. There are different things: introduction, question, answer. You can do group activities, competitions. So it all depends. And if we have a virtual session, then passing around a question also helps, where they type about themselves, what are their dreams, what are their aspirations. So we are creating a comfortable environment. We are encouraging communication, breaking down the barriers between the different people, because we will have in a group or a meeting people from different areas and language speakers. So the advantages are, it's like a warm up before we do the exercise, and we kind of interact with each other. Sometimes it could be awkward if you're asking very personal questions, or something which is a very embarrassing question, like if you are asking, say, in a group, you're having a program in your hospital, and you are asking somebody who is your favorite person. So we try to avoid questions which are very personal. Again, keep it very simple. It should not take a long time. It should just be 5 minutes in the beginning of the session. So it just kind of breaks the ice between the people. Like we had the introduction in the first session, we spoke about ourselves. Then we had the communication of the critically ill patient. This is one of the ice-breaking session. So I would just like in 2 minutes for everybody to start writing down in the chat box a list of 3 things you will do if you won 10 crores in KBC. Or you could just write even 1 or 2 things, or maybe what you would want to, your dream, what you would want to buy. This is the question for all the participants today. Please write down in the chat box what you would like to do, any 3 things or 2 things if you won 10 crore in Kaun Banega Crorepati. All right. And ultimately my take home messages. So I would like all of you to start typing before Suyog starts his participation, the question that I have asked you. Please type down what you would like to do, 3 things, or what you would like to buy, or what would you do if you won 10 crore in KBC. So the take-home message is ice-breaking activities are important when you start the session. to help the participant get to know each other, especially if your team is new, like this platform. We are 12 to 14 of us, totally new, different backgrounds, different places we are working. So it's now after 4 or 5 sessions, we really kind of know each other. We know who will join early, who will join late, who will participate, not participate. So it's like we are like a family now. And of course, when we finish the program, I'm sure we will all leave with good memories. And that's when I will finish my session. Thank you.
Thank you, Dr. Priyanka. I think that was a wonderful presentation and very quick. That's very nice. Yeah. If you could stop sharing.
And I'm waiting for the answers in the chat box.
Oh, yes, I can see some answers. Wonderful. I'll start my venture. Okay, great. And what more? Travel with. Okay, travel world, investment donate. Wonderful. Buy a farmhouse and consider retirement. जय प्रिया, अभी तो पैदा नहीं हुए रिटायरमेंट की बात कर रही हो. There should be no word called retirement. Okay, Dr. Previn will go to UK, watch tennis final match at the Wimbledon at the Central Court and have lots of strawberry and cream. Is it your granddaughter who typed it? Or she came in your body and she made you write? Good holiday trip to see.
Really nice. I'm waiting for the others also. Satyapal, आप अगर 10 करोड़ जीत जाएं, कौन बनेगा करोड़पति में? तो आप क्या 3 चीजें करेंगे? And also Anas.
मैं सबसे
Because
पहले
I was in medical college, so I know the backbenchers who want to sit quietly.
मैं 3 पार्ट में इसको डिवाइड करूंगा. एक तो मैं अपनी फैमिली के लिए कुछ अमाउंट रखूंगा. दूसरा मैं वर्क के लिए उसको खर्च करूंगा. तीसरा मैं थोड़ा सा धार्मिक हूं मैम, तो मैं उसमें भी डोनेट करूंगा.
Very good. Thank you so much. Thank you. Anas?
जी मैम, मैं वर्ल्ड टूर पे जाना चाहूंगा.
अरे वाह,
फैमिली के साथ.
वेरी गुड, वेरी गुड. अरे वाह, डॉक्टर सियोगी अच्छा लिखा है आपने. I'll make my caravan. That's good. That's nice.
Okay. Thank you so much.
Thank you, Dr. Priyanka. I think that was wonderful. So you have made a good beginning. One, by picking very good topics. Second, doing it in a good manner, and also presented very well. So I think now we have the idea about ice breaking as a way to start your program, because that breaks ice and open people and connect people with each other. And every time you do a session, make sure that you have some ice breaking activity integrated with your session. I think, I mean, if you see, every time I start my discussion,
I want answer from Dr. Indu also.
Honestly, I've never thought, because money is not the constraint for me to fulfill my dreams. So I don't know what will I do, because I don't need money to fulfill my whatever but I can think and come back. अगर मिल ही गए तो क्या करना, ये तो सोचा जा सकता है ना, सोचा जा सकता है. बिल्कुल बिल्कुल. But thank you, that was very interesting. So any questions for Dr. Priyanka from anybody? So it was a very crisp presentation, Dr. Priyanka. Thank you. Thank you. Yes, Dr. Suyog, can we have your presentation? Dr. Suyog, you're not visible. Yes. Even your face is blurred. So maybe, are you very far from the camera?
Is this okay now?
No.
Oh.
I can see a kid behind you. Neither your face.
Oh, my daughter.
Oh, lovely.
I just
so
get this background. Yeah.
So because we are talking about presentation, nahi, ab theek hua. Yeah. So just to let you all know, for Zoom, because you will be doing programs, and if you're doing online program, so behind me, it's a virtual background. It's a virtual background, but it looks very real because I'm using a green sheet behind me. So when you use green sheet, the virtual background looks very natural. So whenever you do your programs, I request you to make sure that you use a green sheet behind you. and that would help you create a very natural, ambience. Yeah. Yes, Dr. Yo. So go ahead, please. Yeah.
Yes. Hi. Good evening, everyone. I'm Dr. Suyog, and we'll be talking about how to create or creating activities in the training sessions for you. Okay. With and thank you for that lovely icebreaker session. So we don't need it that much of energizers to before begin with. Uh, so I would recommend everyone, and I would request everyone. Uh, Let me just first share my screen. Can someone confirm, please? My screen is visible.
Your voice is again not audible. It's breaking. So maybe you'll have to switch off your video.
Is this visible?
Yes, your screen is visible.
Yeah.
But when you speak, the
Screen is
voice
visible.
quality is not. Yeah.
Yeah.
Yes.
So I would recommend everyone. I would request everyone to please scan this barcode, which you can see on the screen to begin with. Can everyone see the barcode on the screen?
Yes.
Yes, yes.
Yes.
Yeah, I would request everyone to just uh, uh, scan this barcode, and there would be two questions following this. Can just everyone tell me like if they have reached?
Yes. What do you think about including activity?
Absolutely, yes. So you can please write down your response as soon as possible, because we have very less time remaining in this activity. Yeah. Okay, so there is one response that we have. One is a practical idea. It is a wonderful way to conduct sessions. Yes, absolutely right. Yep. Any more responses? Yes. Definitely include activities, as it makes the session more impactful and easily remembered. Absolutely. So I can see a lot of answers coming in. Yes.
तो व्हाइट बोर्ड की जगह मुझे लगता है मेंटीमीटर ज्यादा अच्छा है ना?
बहुत
व्हाइट बोर्ड
बढ़िया
में
मैम.
तो
Yes, yes.
या व्हाइट बोर्ड में it becomes cumbersome to write.
Yeah, and if you get the paid version, the pro version, it is even more killing.
So this is a pro version or a free one?
This is the absolute beginner free ones. Yeah.
Okay, but how many times can you use it?
I can use only 2 slides in the free version. But the pro version, you get all the add-ins in the Microsoft and everywhere, in Google Sheets and
In
everywhere.
Kahoot also,
So it
in
is,
Kahoot also, I tried a couple of times, but then after that, it is not,
yeah.
it's not
I
letting.
have tried Kahoot, but I think so. Mentimeter is much more engaging. Yeah, absolutely. Thank you. But we have got good responses, and yes, it is
Yes.
interesting to have including activities and everything. So can we now move on to the next question? Oops, oops. That is the next. So, what percentage of knowledge retention do you think is achieved through engaging in activities during a training session? ट्रेनिंग सेशन के अंदर अगर आपने एक्टिविटीज इनकॉर्पोरेट की है, तो आपके ट्रेनीज का या आपके पार्टिसिपेंट्स का रिटेंशन कितना है, कितना याद रख पाएंगे वो लोग, आपको ये बताना है. ओके, रिस्पॉन्सेज आ रहे हैं, आपको परसेंटेज में बताना है ये कितना है. जस्ट ड्रैग, आपको ड्रैग करना है. यू हैव टू ड्रैग दिस स्लाइडर एंड यू विल बी एबल टू मार्क दिस. There are 4 responses as of now. Okay, or we are it. Great. So if everyone has done it, yes, we have 7 responses. Okay. Thank you so much. So we'll now begin with the presentation part. Uh, so it's all about creating interesting activities in your training sessions. Uh, so what does the research is? So for the second question or the second poll that we took, it says that the retention by practicing by doing is around 75%. So if you want your participants to retain or to reproduce what the skill or the knowledge that you are delivering in your training is through practice by doing. So engaging into activities is much more effective than any other methodologies like lectures or reading or anything. So in fact lectures can have a retention rate of only around 5%. So only 5% of the content can be delivered through lectures. So in this presentation, what we are going to look about, it's about the training landscape, how it has been changing. Now, the time has changed. Like the one way communication, जहाँ पे एक sage या एक ऋषि मुनि जहाँ पे अपनी बात बताते थे, we are not going to do that. I mean, the landscape has changed of the training. It's a two-way communication. It's a facilitative learning. And why these activities matter? Because it would captivate your mind, it would foster collaboration, it would solidify learning, and it would be an enjoyable learning for everyone, every participant. So it's a participant centered approach where the trainer will facilitate this learning experience. And yes, the objective is to make the learning as enjoyable and to stimulate the critical thinking and equip the participants with the real world scenarios. And so these real life scenarios can be taken into these activities so that the participants have a good knowledge about it. So where can these be used, especially when we are talking about the healthcare perspective? In the healthcare perspective, also there are different domains. So in case you're dealing with patients, you're dealing with the medical educations or the clinical protocols or other informed consent. So all these topics where you will need to have these skills to be imparted, or these topics need to be imparted, all these activities can be catered to these particular topics. So before going into all these things, there are also the trainer needs to also be mindful about the advantages and the disadvantages that the activities could have. So one of the few of the advantages that I have already shared on the screen, it is about that it would enhance engagement. You will engage. The retention is very much, as we have already talked about. There is active participation. The participation will not be like very dull. There is motivation. There is different style of learnings, as we have already seen in this training program, that everyone has a different learning style. And when you explore these particular activities, the participants are engaged and they will engage in through their different learning styles. And similarly, there are some disadvantages also. It could be time consuming. There could be some resistance from the participants, especially when if you're taking a topic which is really very very critical, very sensitive, very emotional. So in that case, there would be some resistance from the participants, and it would be difficult to manage if it is for a larger audience. You won't be able to cater all their challenges what they are experiencing during those particular activities. So those are some disadvantages that these activities will have. Similarly, when we talk, there are some do's and don'ts, and we know now we are doing an online training. There would be an offline trainings also. So one needs to be very mindful about what are the do's and the don'ts for both online and as well as offline trainings. Now, since we are dealing with an online trainings, you need to leverage technologies. So uh, in the beginning of this particular session, I chose Mentimeter, or the Menti platform. There are breakout rooms, there are whiteboards, there are gamifications, there are many other technologies which are widely available, and especially after COVID, all these platforms are readily available, and most of them are very much free. So you can mix these online platforms, and on, and collaborate all these platforms in your trainings. uh, Whereas in your offline trainings, the scenario will be absolutely different, because we are having the participants one on one, physically present right in front of you. So you will need to plan your logistics very well. You need to have those handouts ready for your participants. You need that physical space in order to conduct those activities, um, you know in an effective manner. Similarly, when you have all these logistics and the space ready with you, you need to communicate very well, so that all the participants are equipped with all the basic communication what they need to do during these trainings. And similarly, then they need to have handouts. And at the same time, which is one of the most crucial thing, is that after every activity there should be a debriefing, meaning uh, what have they interpreted it out of these particular activity, is one of the interesting thing, and one needs to incorporate this particular learning through this debriefing into their session. And similarly, when we talk about do's, we also will talk about the don'ts, that one should be very mindful, uh, since these would actually be very, this would have possess some challenge in during your in conducting your sessions. So if you're doing an online training, you do not overcomplicate with technologies. Now sometimes Zoom technology or the Zoom platform has a whiteboard facility, and it is not very convenient for all the users to to actually access it and use it effectively. Similarly, if your connectivity is low, then the issues uh, would actually will spike up. Neglecting some engagement, you are just speaking. If you tell your uh, participants, if you ignore that, they are not turning on their cameras, you do not know what they are actually been doing. So neglecting that engagement, sometimes the activities can get monotonous and everything. And similarly, if you are doing an offline training, if you are not prepared with your stuff for your trainings, this could actually will not go anywhere. Sometimes, some trainers will, or the training teams will overlook safety, and this could be very harmful. I have seen some of the trainings uh, in the basic life support. They have not taken safety into consideration, where they have not got their mannequins in the trainings, and they have actually uh, told some participants to be the for demonstration, and then they have overlooked some safety issues. uh, there need to be a very clear cut instructions if you are dealing with an offline training, when you are doing a physical training. And similarly, uh, even if you are doing online training or offline training, the timings has to be one of the important factor. And similarly, and the nothing not least, but neglecting the participants involvement. So you need to understand that all the participants are understanding, are they comprehending well with the activities, are they fine with that, are they are okay with that. And one needs to understand well, one needs to monitor those factors also, in order to conduct these activities. So activities are very engaging, they are very helpful for the trainers, they will make your session very engaging. So I would highly recommend you to all use training use activities during your training sessions, uh, to make your presentations and make your trainings more effective. Yeah, Thank you so much and impactful. I hope I'm audible.
Yes, wonderful. Thank you. I think it was a very good presentation. As we are talking about, using activities, we have really discussed at length about. Can you stop sharing? I think your sharing is not yet done away with yet. Thank you. Yeah, no, it's better. Yeah. So you have highlighted the importance of using activities in any program, and I agree completely. I mean, just depending on PPT and some didactic is not enough. It has to be through activities, absolutely. And there's so, I mean, actually, Dr. Siyog had come up with an idea of a very beautiful activity that he wanted to do with all of you, but I kind of stopped him. So maybe in next session when I share them the concern, and if they're okay, then maybe we can request Dr. Siyog to do that activity. That was a very nice activity, but it would generate mixed reactions. So I was little skeptical to allow you to do that. So I hope you understand my concern. So any questions for Dr. Siyog?
What if we have planned activity and it doesn't work, like this Mentimeter, or how do you troubleshoot?
Yeah. Whenever you go, you always have plan A, plan B, plan C. So my first plan A was the activity what Dr. Indu ma'am just mentioned. It didn't work out. I had plan B, which was Mentimeter. I already have plan C, which was there in place.
Thank you. I think Dr. Siyog, that's very important. So more trainings you will do, more options you will have at hand. And as very rightly said by you, if you have 2-3 plans in at hand, you will be able to manage something. And there's no harm even accepting, sorry, this is something new for me also. So I think let's shift to the other one. Yes, Dr. Praveen, I think you wish to add something.
The uses you said clinical protocols. What activity would you plan for demonstrating a clinical protocol?
Yes, absolutely. There would be a checklist. There would be a situation in a protocol, right? Dr. Praveen, is that okay?
Yeah, clinical protocols basically they're protocols. This particular situation should be managed this way. So what activity we can plan for that?
You can do a role play in this.
Mock exercise.
You can do drills also, like we do PPH drills, things like that, postpartum hemorrhage drill.
Yeah, but I would also be just wanted to highlight that if you are dealing with activities, not every topic will have an activity to do it. There are some things which you really cannot manage through activities, because some things they are very objective, and they cannot be very subjective to it.
Yeah,
So you
basically
just need to,
because some of the things can't be. For example, a clinical protocol for management of community acquired pneumonia. What activity you can plan for this? Role play also will not work.
It all depends upon the participant to whom this training.
No, but maybe you can give a checklist of these are the symptoms. This is the common cold. This is for pneumonia. If this is there, so whether they have understood or just like
maybe
quiz.
Quiz.
This Mentimeter quiz.
Quiz can be.
I can just one. I have just one activity for this one also. Say if you are in an offline training, Dr. Praveen, if you are there, I can just tell you if this could help you out.
Yeah,
I just have some. Yeah. What exactly you wanted to deal? I'll just take 2 minutes. That's all.
Yeah.
So what exactly you wanted to
basically
share
some sort of an activity. One of the you enlisted. So you mentioned clinical protocols. So many clinical protocols we are using, but that normally clinical protocols are communicated in the format of a PowerPoint or sort of a thing. It is a document. I find it somehow difficult to attach activity with that. If it will be the sort of forcing activity on the clinical protocol.
No.
No, I think
I'll tell
Archana
you.
There's
replied
an
you well.
algorithm. There's an algorithm. There's a
No,
flow
but
chart.
you can create something like one part of it is missing and then they need to. So if you just tell them first, this is the protocol, then you make some important step disappear in that, and then they should get back to you. Because otherwise, if you're just telling them this is the protocol, they may miss an important step. So
Okay.
so just create some
So it
quiz
could
out
be
of it.
post-training quiz
address that,
also.
Dr.
One
Priyanka?
second, Dr.
Yeah.
Suyog. Pre and post training quiz also could be developed around the protocol. So it's more
Absolutely.
like they will get to know how much they know, and then once you have done the training about whatever discussion you have done with them as per your plan, and then you give them a quiz to answer, so you get an idea how much they have learned, and also it's an interesting way of checking their takeaway.
There are polls also to add.
Yeah.
And
Yes.
even better, I can tell you about, I've done these protocols also. So we have had our mannequins during our training sessions, so you can have your mannequins, and you can have a simulated session or a simulated environment, for that particular protocol that you wanted to. And you can make stations, you can make different station, table 1, table 2, table 3. So if you have 20 steps, say for example you have 20 steps, so divide first 5 at one table, the next 5 on the second table, third table, fourth table. So you have 5 session, 5 tables for different sessions. So you have to group your protocols or the activities as per those steps. And then on those each particular table, you then break out all these steps of these protocols, and you can create all these activities again, and you can distribute your participants on these 5 tables in 5 different slots, and you can have them create an activity, or give them um, some paper or chart paper, to write all these things, and then paste it on your on the board or on the whiteboard, or they can write it. You can give them paste it. So these are all for the offline ones. So the online ones, as Dr. Indu just mentioned, there are questionnaires. You can also have polls. You can have open-ended questions. You can have list of questions. So all these forms and all these tools are readily available, so one can actually capitalize on these. Yes.
So we do clinical drills for postpartum hemorrhage, eclampsia, neonatal resuscitation, all that. Then we just make into stations, so make small groups and make them do the.
Absolutely. In fact, these are
We
being
remember only
conducted.
that.
Yes, I have worked with the UNICEF and the Save the Children, and I have been part of their trainings, and we do all these stations. We make all these stations for neonatal resuscitation. We do it for PPH. We do it for say post-abortion complications. We do have all these, but we need to have those mannequins ready, like those Mama Use and Mama Natali. All those mannequins are needed. So one needs, so there is the financial implication is also there when you're doing such clinical trainings, offline trainings. Yes, because one mama you will cost you something around 60 to 70,000. Yeah.
You can use
Okay, I
the
think
money in KBC for that.
Yeah. And there is this company called Laerdal, yeah, if I'm not, and they do make good models, so one can actually use this. Yeah.
so. Thank you for a very lovely discussion. I think even on this point, and that means what you were presenting was being not only heard carefully but also analyzed. And
Yes.
I mean that's really good. That's the purpose, that we don't take everything blindly, but we analyze before we and accept it and take it in. Wonderful. Thank you so much again, Dr. Suyok, for a lovely presentation.
Thank
So,
you.
do we close this session here? I know it's 10:35, so I can see some of you really very tired and sleepy. But that's the way we are going to be in the next 4 more sessions. So please bear with me and enjoy the discussions. Thank you. Good night. I've shared the feedback form. Hopefully, I hope to see more feedbacks this time. My stories impact on all of you. Thank you. God bless you. Good night. Bye-bye.
Good night, all.